गुड आफ्टरनून भाई, गुड आफ्टरनून। एनीवेज, क्या लास्ट टॉपिक क्या चला था दोस्तों? ओके, व्हाट इज द मोस्ट स्पेसिफिक टेस्ट ऑफ सीमन? मोस्ट स्पेसिफिक टेस्ट ऑफ सीमन, एनीवन?
LDH.
LDH. Most specific test of blood? Most specific test of blood? Okay. What is the answer? Spectroscopy. Very good. It is spectroscopy. Which is the best test for blood grouping? Blood grouping. Acid elution test. Very good. Acid elution test. Acid elution test. Nice. Police custody, police firing, police interrogation, death are inquested by? माइक म्यूट रखो दोस्तों. Inquested by judicial magistrate. Which two IPC are decriminalized? Which two IPCs are decriminalized? One is 309, that is attempt to commit suicide. Another is not 409, it is 497, it is adultery. Adultery. Custodial rape punishment, which IPC? Custodial rape punishment, which IPC? 376. Gang rape punishment, which IPC? Gang rape 376 D. D. D for दो, याद करने का ट्रिक भी बोला था. Very good. Okay, which is the best part of dying deposition? Which is the best part of dying deposition? Cross examination. Yes, cross examination. What is the age limit of juvenile in India? Below what age? Below 18. What is the age limit of taking oath in India? 12. 12. Minimum age for criminal responsibility? 7. Age for full criminal responsibility? 18. Child below, a girl below what age is a statutory rape? Below 18, it is a statutory rape. Very good. Which is a broad phenomena, will or consent? Will or consent? Will. Will is a broad phenomenon. Yes, will is a broad phenomenon. Okay. Impotency is a defense for rape or not a defense for rape? Okay. Involuntary intoxicated person committing crime gets advantage of? Involuntary intoxicated person, advantage of which IPC? Yes, Sanu, it is 85 IPC. Insane are protected in India under which IPC for crime? 84 IPC. Adequate capacity and appreciate the criminality comes under which law? Word, American Law Institute test. Very good. Free agency of the will lost comes under which law? Irresistible impulse test. Irresistible impulse test. McNaughton rule implemented in which year? (1843). 84. You have to remember. Okay. Okay. Pink feathery crystal in which test? Pink feathery crystal of hemochromogen. Which test? Takayama. Very good, Takayama. Brown rhombic crystal, which test? Tickman. Very good. Tickman test. Edmund Locard exchange principle is useful for what? Identification or crimes in examination? Crimes in examination. Medullary index value is high in animal or human hair? Animal or human hair? Medullary index value high in. Yes, it is animal hair. Animal hair, everything is good for medulla. IPC, Indian Penal Code law, implemented in India in which year? 1862, 1872. IPC. 1860. Not 1862, it is 1860. Okay. First postmortem conducted in which city? Chennai. Very good. चेन्नई. लवली लवली भाई साहब, बहुत बहुत धन्यवाद आपको. डाला वो ठीक है. अरे यार तू सोनू, वो ग्रीन टी क्यों नहीं बनाती जो वो वाली? अरे वो जो बॉईल करके बनाते थे. चेन्नई. CRPC amendment, first criminal amendment act in CRPC, which year? First, 2013. After Nirbhaya case. After Nirbhaya case. Assistant session court, maximum punishment, maximum fine. Assistant session court, 10-year fine. What is the maximum fine, my dear friend? Yes, it is unlimited fine. It is unlimited fine, no limit. That's okay. That's okay. Very good. Very, very good, friends. Okay, so now we are starting. No issue. We are starting the next topic. Very, very important. डॉग सिटी अपना नाम ओरिजिनल लिखो, ठीक है? कल से सारे लोग अपना नाम ओरिजिनल लिखेंगे और अपनी फोटो लगा देंगे. चलो कोई बात नहीं. No issue. So this is almost time to start the class. नहीं विघ्नेश, अपना नाम वहां पे लिख दो ना, जूम आईडी में. कोई दिक्कत थोड़ी, कोई पकड़ थोड़ी रहा है. So now we can start the class. Okay. Now we'll discuss few very, very important IPC. Few very, very important IPC. Now first, what is the difference between kidnapping and abduction? What is the difference between kidnapping and abduction? What is kidnapping? A boy below 16 years of age and a girl below 18 years of age is taken away from parents. Boy below 16 years of age and a girl below 18 years of age is taken away from parents. This is kidnapping. Kidnapping is defined under 2 IPC 360 and 361 and punishable under 363. And also how to remember? You can remember by a very simple trick, 361, 361, or you can remember 3 pick 1. It means 3 people are picking. So 3 pick 1 is equal to 3 sick 1. This is a IPC definition of kidnapping. Definition of kidnapping. But sir, if the boy is above 16 years of age and a girl is above 18 years of age, if a boy is above 16 years of age and girl is above 18 years of age, if you confine in any place like this, this is known as abduction. Abduction definition and punishment all comes under 362 IPC. Abduction definition and punishment all come under 362 IPC. Anyways, this is a very simple trick. Kidnapping a child below 16 years of age, boy below 16 years of age, and a girl below 18 years of age, this is kidnapping. This is kidnapping. This is kidnapping. A boy below 16 and a girl below 18. This is kidnapping. Abduction is boy above 16 and a girl above 18 is an abduction. Now, sir, the next IPC is assault. Sir, what is assault? You are applying criminal force and any person gets fear. You are applying a criminal force and any person gets fear. This is known as assault. Assault. Dr. Saab, here fear is very important part. If the person gets fear by your criminal force, if person gets so any kind of criminal force where person gets fear, this is assault. This is known as assault. Sir, actually fear is the most important part. It means, sir, person is supposed to get fear by any, like this may be threatening. I'm giving example. What are the example of assault? Threatening, dhamki dena, any kind of preparation, or any kind of attack. So there may be sexual assault, physical assault, or many kind of assault. Now, Dr. What is the IPC for assault? IPC for assault is 351 IPC, 351. Assault IPC is 351. There is a Hindi trick for you. आपने 3-5 करके एक आदमी को डरा दिया. This is a Hindi trick. The person who know Hindi, they can easily remember. आपने 3-5 करके एक आदमी को डरा दिया. 351 is an assault. That's a very simple trick. But now I am coming to a very, very important IPC, that is indecent assault. That is indecent assault. Sir, indecent assault IPC, it is only for female. You are doing indecency. You are doing indecency with female only. You are doing indecency with female only. This is known as indecent assault. Now, a very important MCQ comes. Sir, what is the IPC for indecent assault? What is the IPC for indecent assault? The IPC is 354. The IPC is 354. This is a very important MCQ. 354 IPC. Now, how to remember, sir? You are doing some indecent act with female. 3-5 आपने किया. F for 4, F for female के साथ. This is a very simple Hindi trick. 3-5 आपने किया. F for 4, F for female के साथ. This is known as indecent assault. 354 IPC is further classified in 354A, B, C, D. A, B, C, D. Now, sir, what are A, B, C, D? 354. Dr. Saab, in indecent assault, the first is 364A. It is sexual harassment. It is sexual harassment. First is this. Second is public place misbehavior. C, I can convert C in this C. C, you can see. Dr. Saab, C, if you see any female, this is known as voyeurism. D, D का मतलब आपकी डिमांड बढ़ना. डिमांड बढ़ती है तो आप उसका पीछा करते हो. That is stalking. Stalking. Voyeurism and stalking. And Dr. Saab, you won't believe, voyeurism and stalking both are cognizable offense. Voyeurism and stalking both are cognizable offense. I have made, this is 354A, 354B, 354C, 354D. These are. Now, sir, here punishment is 1 to 5 years. Misbehaving punishment is 3 to 7 years. 3 to 7 year. Again, it is 3 to 7 year. And stalking punishment is 1 to 3 year. These are 354A. Yes, I just converted A, B, C, D. 354D. These are indecent assault. But remember always, it's very simple. Always remember, these IPC, हाँ सा जद कट ले गया इमरजेंसी में कट एमडीएम में अच्छा ठीक है कोई दिक्कत को नहीं जब तो 99.6 तो ज्यादा दिक्कत को नहीं हाँ बीपी है बाकी को नहीं मैंने पांच छुट्टी दिलवा दी जल्दी हाँ छुट्टी दिलवा दी घबराहट हुई ठीक है सर so it's very simple to remember. A, harassment. B, misbehave. C, I converted C in C. D, it is धक्का देना या stalking करना. That's a trick. D for धक्का, धोखा या stalking. Anyways, these are the punishment under 354 IPC. Now sir, but remember sir, 354 is only applicable you are doing some wrong act with female. 509 IPC. What is 509 IPC? It is insulting a woman. The 354 is a little bit high IPC. It is insulting any girl or any woman. This is 509 IPC. 509 IPC. Now, how do you insult? Sir, you can insult a female by word, by song, by obscene remark, by gesture, or by any abusive language. So these are there. Even sir, staring. Don't stare a female. If you are staring a female, अगर आप किसी female को घूरते हो for more than 14 seconds or 14 seconds, it is a insulting a girl. So by word, अगर आप कोई शब्द बोलते हो, by song, by obscene remark, by gesture, अगर आप आंख मारते हो, सीटी बजाते हो, abusing, sir, all these comes under 509 IPC. This is insulting a girl. So sir, 354 and 509 IPC is only applicable when male does these things to the female. If female does these things to male, it's not a punishable offense. अगर फीमेल ने मेल को आंख मारी है, फीमेल ने गाना गाया है, फीमेल ने लड़के का पीछा किया है, फीमेल ने घूरा है, it's not punishable. So it is only punishable when these things are done by male to the female. Male to the female. So again, just revise it, my dear friend. I'm just putting a question. Okay. Saranya Sekar. Okay. Write down. Voyeurism come under which IPC? Voyeurism. Voyeurism comes under which IPC? Voyeurism. 354C. Yes, Damodaran. 354C. Yes, C. 354C. सिर्फ C मत लिखो बेटा, साथ में 354 भी लिखो. Stalking comes under which IPC? Stalking comes under which IPC? 354D. Punishment for kidnapping. Punishment for kidnapping. 363. Definition of kidnapping. Definition of kidnapping. Okay. Staring a woman or girl comes under which IPC? Staring. Gurna comes under which IPC? 509 IPC. 509 IPC. What is 510, 510 IPC? If after consuming any alcohol or any drug, if you are misconducting with anyone, misconduct after consuming alcohol is 510. And what is the trick to remember? Sir, जब आप शराब पी लेते हो तो आपको 5 का दुगना 10 डबल दिखने लगता है, 5 का डबल 10। तो जब 5 का डबल 10 दिखने लगता है, आपको डबल दिखने लगता है, तब आप मिसकंडक्ट करते हो। दैट्स अ वेरी सिंपल ट्रिक। इफ 5 become 10, then you are misconducting. That's a very simple trick. This is 510 IPC. 510 IPC. Sir, acid throwing is known as vitriolase. Acid throwing is known as vitriolase. There are two IPC, 326A and 326B. It is acid attack and it is acid attempt. What is the trick, sir? Sir, very simple trick. 3 लड़कों ने 2 लड़कियों पे छिड़क दिया एसिड। दैट्स वेरी हिंदी ट्रिक इट इज। 3 लड़कों ने, दीज ऑल आर आईपीसी, 3 लड़कों ने 2 लड़कियों पे छिड़क दिया एसिड। 3 2 6, 3 लड़कों ने, यस, 2 लड़कियों पे छिड़क दिया एसिड। 6 फुट छिड़क दिया, ओके, इट इज एसिड अटैक। बट सर व्हाट इज द ट्रिक फॉर दिस? 3 लड़कों ने 2 लड़कियों पे छिड़का, बच गई, लड़की बच गई, बी फॉर बच गई, दैट इज अटेम्प्ट। So both are coming under vitriolase. Both are coming under vitriolase. Both IPC are coming. 3 ने 2 पे छिड़का एसिड, 3 ने 2 पे छिड़का बट बच गई, that is acid attempt. Okay, another important trick. It's very simple. Now, sir, come to criminal abortion. Criminal abortion. Now, how to remember this IPC, sir? See, criminal. See, this is very simple. C is number 3 alphabet, A is number 1 alphabet, and B is number 2 alphabet. 312. So criminal abortion IPC start with 312. After 312, 313, 314, 315, 316. These are IPC of criminal abortion. These are IPC for criminal abortion. C is number 3 alphabet, A is number 1, B is number 2. This is criminal abortion. What is criminal abortion? Criminal means you are doing abortion criminally. You are killing fetus inside uterus. You are killing fetus inside uterus. Now, sir, how do you kill? Sir, first type of criminal abortion is this, second is this, third is this, fourth is this, fifth is this. Now, what is this? The 312, if mother is giving consent, if mother is giving consent to kill her child, like she's having girl child and she wants to kill, this is 312. If mother is not giving consent, still husband and in-laws family want criminal abortion, it is 313. With consent, without consent. If mother dies, mother also dies during this procedure, that is 314. 314. Okay. If age of fetus is more than 28 weeks and you want to kill, this is 315. And Dr. 316 is you want to kill mother. You want to kill mother, but fetus is killed. But mother is not killed, fetus is killed. Now, Dr. I am putting some question to you. You will understand then what is this, sir. Which IPC where mother and doctor both are punishable in criminal abortion, where mother is giving consent for criminal abortion? What is the IPC? Anyone? 312. During criminal abortion process, if mother dies, which IPC will be applicable? 314. Absolutely right. If your fetus is 8-month old and you want to kill that fetus inside mother uterus, this is very dangerous. Okay, which IPC will be there? Yes, 8-month old means it is more than 28 weeks, because 28 weeks is almost 7 months. 315. I stabbed a pregnant mother. I stabbed with a knife a pregnant mother, but mother survived and fetus is killed. Which IPC will be applicable? Yes, absolutely right, sir. Now you got everything correct. Now you got everything correct, sir. Absolutely right. Love you all. Love you all. Now you understood. But sir, it is killing a fetus inside mother uterus. It is killing a fetus inside mother uterus. This is criminal abortion. This is criminal abortion. Okay. So everything is clear. No doubt will be there. Very good. Very good. अरे जानू तुम्हें समझ में आ रहा नहीं आ रहा है सबको? हेलो, सबको समझ में आ रहा नहीं आ रहा है? लाजवाब, वाह वाह वाह, वेरी गुड. चलो कोई बात नहीं. Now sir, listen carefully. How to remember what is culpable homicide? Sir, whenever homicide word comes, that means is human is killed. Whenever homicide word comes, human is killed, and culpable means criminal. Means sir, what is the meaning of this? By criminal intention, if any human is killed, this is culpable homicide. Dr. Saab, culpable homicide definition is 299 IPC. Culpable homicide means by criminal intention, if any human is killed, this is culpable homicide. Okay. Now, sir, it is further differentiated in two categories: murder and not amounting to murder. Sir, what is the difference? In both condition, person is killed. In both condition, person is killed. Now, giving example, X fires on Y. X fires on Y and Y is killed. Sir, it is murder. X want to kill the person. Y is killed. Yes, it is. It is. Yes, it is murder. Doctor, definition of murder is 300. Punishment of murder is 302 IPC. And sir, punishment is LI to DS. LI to DS. That's a very simple example. X fire, I stabbed a person, and the person is killed. It is a murder. So first thing is murder. Now, what is not amounting to murder? See, sir, X fires on Y because X was provoked by Y. X was provocated by Y. उसको उकसाया गया. You can write down provocated or provoked by Y. But sir, what happens? Z is killed. Z is killed. Now, sir, here two things are there. First, it is not the X wanted to kill person. The provocation is a factor. Provocation is factor. Second, Z, another person is killed. It is, sir, not amounting to murder. It is not amounting to murder. It is punishable under 304 IPC. Punishment up to 10 years. It is punishable under 304 IPC. Sometimes what happens, like a very simple example, provocation is there. You don't want to kill, but still you fire, and some other person is killed. That is a different thing. It is not amounting to murder. It is a culpable homicide, not amounting to murder. Not amounting to murder. It is punishment. So sometimes what question comes? Culpable homicide not amounting to murder, punishment is known as culpable homicide. It is. Dr. Saab, I am putting 4 questions. See, I am putting 4 questions. Try to write down. What is definition of murder? Which IPC? Which IPC? Definition of murder? 300. Punishment of murder? Punishment of murder? 302. No doubt. X fires on Y and Y is killed. This is 300 and 302. Now, so listen. What is definition of culpable homicide? Anyone? Definition of culpable homicide 299. Now, if you get a question, what is punishment of culpable homicide? What is punishment of culpable homicide? 304. Because not amounting to murder is considered as a culpable homicide. Not amount. So it is a full term is culpable homicide not amounting to murder. But we can write down culpable homicide also. It is provocation is a factor and some other person may be killed. This is culpable homicide. This is culpable homicide. Okay. Simple. Now, sir, we can see it is a very simple example. Hello. करूँ सा शाम का बात करूँ क्लास चले. It is 304A IPC, 304B IPC. All are IPC, okay, no issue. Sir, A for apron and A for accident. That's very simple. Any negligence cases, apron is a doctor negligence, that is a medical negligence, or any kind of negligence case by which if the person dies, this comes under 304A IPC. Punishment 2 year plus minus fine. Minimum punishment 2 year plus minus fine. 304B, B for bride, B for bahu, B for bride, B for bahu. That is definitely dowry death. Bride, bahu, dowry death. Minimum punishment 3 plus 4, 7 year, and LI, life imprisonment. Minimum punishment 7 year and LI, that is life. That's very simple. B for bride, B for bahu, A for apron, A for accident. Simple trick to remember. Now, sir, till we have discussed that person is dying. Person is dying. Now, what are attempt? What is the meaning of attempt? Attempt means person is not died, person survived. Like attempt to murder, attempt to culpable homicide, and attempt to suicide. Sir, all are in sequence. Attempt to murder is 307 IPC. Attempt to culpable homicide 308 IPC. And attempt to suicide is 309 IPC. Now tell me, which IPC has been decriminalized? No punishment for which IPC? No punishment for which IPC? Yes. There is no punishment for 309 IPC. Now, sir, I am giving two questions, just write down. Okay, listen. X fires on Y, X fires on Y, Y survives. X is punishable under which IPC? X fires on Y, Y survives. X is punishable under which IPC? Why 304? And X fires on Y, firing on Y. X Y पे fire कर रहा, Y survives. It is what, my dear friend? It is attempt to murder. 308 क्यों लिख रहे हो? Listen. Y provokes X, then X fires, and Y survives or X survives. Z survives. It is what, my dear friend? It is 308. X fires on Y, Y dies. Which IPC will be applicable for punishment? X fires on Y, 302. Very simple. Very simple, my dear friend. Why are you getting confused? Accidental case, doctor's negligence case come under which IPC? Which IPC? 304A. Dowry death is punishable under which IPC? Yes. Let me see. Yes. Very good. शराब पी के बदतमीजी करना, अल्कोहल पी के बदतमीजी करना, मिसकंडक्ट आफ्टर अल्कोहल, विच आईपीसी? 5 का 10 हो जाता है 510. यस इलाराबा, यस 5 का 10 कर दो. 510. Okay, done. This is very simple. Okay, I have told you some very simple IPC. Now I'm coming to sir ILD. You can remember, sir, one more IPC. Wife is tortured. Wife is tortured, physical or mentally. There is 498A IPC. Battered wife. Wife is tortured. It is 498 IPC. Wife is tortured. ILD, interstitial lung diseases. ILD is interstitial lung disease. But sir, it is not interstitial lung diseases. It is injury, life, and death. Sir, injury, life, and death is defined under 44, 45 and 46 IPC. क्या डॉक्टर साहब, जब आपको चोट लगी, when you are injured, it is 4, but when you are died, you are 6 out of the stadium, out of the ground. Out of the ground is death, chokka, chakka. 2, 4, it is injury. 4 and 6, it is death. Injury, life, and death. Now, sir, what is injury? What is an injury? Sir, as I told you, injury is 44 IPC. Injury is 44 IPC. It involves 4 components. Any illegal harm of 4 components. What are these 4 components? Any illegal harm for 4 components. What are these 4 components? You can see body, mind, reputation, and property. Means you are harming the body, you are harming the mind, you are harming the reputation, or you are harming the property, taking away the property. It means injury is not only a body injury, mental harassment is also injury, insulting a person is also injury, taking away the property is also an injury. So injury is involvement of 4 components. These 4 components are body, mind, reputation, or property. Sir, but this component is very important. Body injury is known as hurt. Bodily injury is known as hurt. So now tell me, which statement is correct, A or B? What is A statement? Hurt is a type of injury. What is B statement? Injury is a type of hurt. Which statement is correct? Hurt is a type of injury, A. Injury is a type of hurt, B. Now let me see your answer. Yes, A is correct. Hurt is a type of injury. A is correct because bodily injury is known as hurt. Now, sir, very important word comes. Hurt is 319 IPC. Hurt is 319 IPC. Grievous hurt is 320 IPC. 320 IPC. 320 IPC. Dr. Saab, this is grievous hurt. All remaining hurt are hurt or simple hurt. It means, sir, what we need to discuss, hurt or simple hurt are 390. What we need to discuss, if we discuss grievous hurt, all remaining hurt are 319 IPC. So we need to discuss what are grievous hurt. What are grievous hurt? Number 1, emasculation. Number 1, emasculation. What is emasculation? Any injury by which a person loses masculine power. By any injury, if penis erection is lost, penis erection is lost, that is emasculation. By any injury, If penis erectile function is lost, that is emasculation. Second, permanent privation of sight of either eye. If your eyesight is lost, but sir, see, here eye function is compromised. Here eye function is compromised. Sir, even like your eyesight is lost, you go for surgery, and after surgery, your eyesight is normal. But sir, still it will be a grievous hurt. Why? Because surgical recovery is not a permanent recovery. It is a temporary recovery, or it is just a artificial recovery. So it is permanent privation of sight of either eye. Permanent privation of hearing of either ear. So eyesight function is lost somehow, ear function is lost somehow. So Dr. Saab, we have discussed three very important parts till now. Penis erection is lost, number one. Eyesight is lost, number two. Ear function is lost, number three. Now I'm coming to number four. Number four, privation is a compromise. Privation of liya garam pani or steam. Privation of member or joint. If joint is lost, that is a grievous. What is member? Member is any part of the body or any organ of the body which has independent function. Any part of the body or any organ of the body which has independent function is member of the body. Now, I will give you example. What are the member? Like, sir, your eye is your member, your ear is your member, your liver is your member, your lung is a member, your kidney is a member. Any part of the body or any organ of the body, if that is having independent function, is known as member of the body. If that organ or member is lost, like someone spoiled your eye, someone crushed your liver, someone is removing your testis is also a member. Testis removal is also a member. So what I want to tell you, my dear friend, any part of the assault is different from this. Assault is a different assault. Even Doxal, assault is a attack. Injury is in body part. Hurt is in body part. Assault is a different criminal attack. Doxal, see, threatening is not an injury, but threatening is assault. Threatening is not an injury, but threatening is assault. But if by threatening you are mentally harassed, then it becomes an injury. Are yes or no, my dear friend? That's the difference. Okay. Anyways, any part of the body, which has an independent function, if that is lost, sir, this is a grievous. So we have discussed four parts. Penis erection is lost, eyesight is lost, ear function is lost, privation of member or joint. Now I'm coming to number five. Sir, by injury, if you are impaired, impairment, loss of power, or permanent destruction. If by injury you are impaired, loss of power, or permanent destruction of any member or any joint. Any member or any joint. Sir, after injury, you are not able to walk, your power is lost, there is a permanent destruction of your member or joint, this will be a grievous. Number 5. Sir, this is a very important part. Permanent disfiguration of face or head. If by injury, your face and head is permanently disfigured, like a very simple example, acid throwing. A very simple example is acid throwing. If by any injury your face and head is disfigured, this is a grievous permanent disfiguration. Number 7, fracture and dislocation. Fracture, this is a symbol of fracture. Fracture and dislocation of bone or tooth. If your bone is fractured, bone is dislocated, tooth is fractured or tooth is dislocated, it is a grievous fracture or dislocation of bone and tooth. Number 7. So what I have discussed till now: penis erection, eyesight, ear, member or joint, impairment, permanent disfiguration of face and head, any scar mark left, and dislocation and fracture of bone and tooth. Now, sir, this one. If you remain in painful condition for 20 days or more by any injury, this is a grievous painful condition. Not able to follow routine work, not able to follow routine work for 20 days or more. Dr. Saab, what is the meaning of routine work? Eating, sleeping, talking, walking, earning. Sir, if these are hampered for more than 20 days or more, this will be a grievous hurt. Or Dr. Saab, the last is every dangerous injury is a grievous hurt. Now a question comes, what is the meaning of dangerous injury? Dangerous means which endangers your life. Dangerous injury means which endangers your life, which affects vital part of the body, which causes imminent danger to the life. I am giving example. I am giving you example. See, sir, heavy stone on the head, heavy stone hitting on the head. This is a dangerous injury. Shooting, someone shoot you, fired you. Stabbing, sir, all are dangerous injury. Every dangerous injury is a grievous hurt. Every dangerous injury is a grievous hurt. But every grievous hurt is not a dangerous injury. Every dangerous injury is a grievous hurt because this is clause number 8, which contain dangerous injury. Dangerous means any injury which endangers your life, affecting vital part of the body. Like I'm giving example. Someone cut your trachea. This is a dangerous injury. Cut your wrist. This is a dangerous injury. Dangerous injury is an injury which affect vital part of the body. Vital part of the body. Now tell me, this statement is correct or incorrect? Injury is a type of hurt. Injury is a type of hurt. No, my dear friend, hurt is a type of injury. Hurt is a type of injury. Every grievous hurt is a dangerous injury. Correct or incorrect? Every grievous hurt is a dangerous injury. No. Nahi, Bhagwan. Every grievous hurt is not a dangerous injury. Every dangerous injury is a grievous hurt. Like, see, if someone fractured my tooth, tooth is fractured. It is a grievous hurt, but not dangerous. But every dangerous injury is a grievous hurt. Every dangerous injury is a grievous hurt. Absolutely right. So these are some very simple explanation, my dear friend. Now, sir, before coming to the punishment, sir, you should know what are dangerous weapon. Before coming to the punishment, you should know what are the dangerous weapon. Sir, dangerous weapon are poison is a dangerous weapon. Shooting weapon by which you shoot, shooting weapon is a dangerous weapon. Stabbing weapon is a dangerous weapon. Cutting weapon is a dangerous weapon. Sir, some animal are also dangerous weapon. Blast, bomb blast is a dangerous weapon. Heat is a dangerous weapon. So poisoning, shooting, stab, cutting, animal, sir, animal, like if you use any snack, scorpion to kill someone, that is a dangerous weapon. You are using some animal to kill. This is a dangerous weapon. Now, sir, we are coming to very simple way to remember. 319 is a hurt. Yes, done. 320 is a grievous hurt. 320 is a grievous hurt. 321 is voluntarily causing hurt, and 322 is voluntarily causing grievous hurt. Now, sir, all are definition. Why I have used word voluntarily? Voluntary means you have will, then you produce hurt. This is a definition. You have will, you wanted to produce grievous hurt, and then you produce. Involuntarily producing grievous hurt is a different thing. Involuntary means you don't want to produce, but still there was a hurt. That is involuntary. Here it's voluntary. Here it is voluntary. Now we are coming to punishment. Now we are coming to punishment. See, punishment 323, 324 IPC, 325, 326 IPC. These all are punishment. Here punishment up to 1 year, 3 year, 7 year, 10 year. Now, sir, how to remember? 323. What is 323? See, hurt, that is simple hurt by non-dangerous weapon. Simple hurt by non-dangerous weapon. It is simple hurt by dangerous weapon. It is grievous hurt by non-dangerous weapon. It is grievous hurt by dangerous weapon. Now, what is the trick, sir? A very simple trick is choka and chakka. Choka and chakka, 4 and 6. Sir, both are by dangerous weapon. One produces hurt, another produces grievous hurt. That's a very simple trick. Simple hurt by dangerous weapon is 354. Now, sir, I am putting some example. Very simple example. A teacher slapped a student. A teacher slapped a student. This slapping a teacher, slapping a student by teacher. This is simple hurt. Weapon is non-dangerous. This is 323 IPC. This is 323 IPC. Okay. Okay. Now see, X fired on Y. X fired on Y. Fire means it's a dangerous weapon. It's a pistol. It's a dangerous weapon. X fired on Y, but Y got just a simple hurt. That is hurt. There is abrasion. There is abrasion. Sir, this is 324. 324. Okay. What is 325? X punched on Y. Y got fracture of tooth. But sir, punching, this is not a dangerous weapon. This is fracture of the tooth. It's a grievous hurt by non-dangerous weapon. But sir, X fired on Y. X fired on Y. Y got bullet inside the abdomen. Sir, this is a dangerous injury. And as I told you, every dangerous injury is a grievous. That's very simple. Very simple explanation. Very simple explanation. Yes or no, my dear?
It's attempt to murder. Yes, sir.
Hello?
It's sir, ये तो attempt to murder भी हो गया ना ये तो.
नहीं, वो there may be 2 IPC or 3 IPC or 4 IPC. Actually, single crime can have many IPC. Okay, so that is a different issue. Means if X fires on Y, bullet is inside the abdomen, there will be attempt to murder. No, it's not attempt to murder. If the person dies, it is a murder. If person dies, it is a murder 302. If person survives, then it is attempt to murder as well as 326 IPC. Are you getting my point? Are you getting my point?
Yes, sir.
Okay. So there may be 2 or 3 IPC. Now, sir, then I have already told you, sir, friend, 328 IPC. Any hurt by poison. Punishment is up to 10 years. This is 328. 330 IPC. It is a IPC for torture. 330. 330. And even you can remember by trick. T for 3, T for 3, O for 0. So everything is inside it. 330. Torture. I have already told you 326A and 326B. Both are IPC of vitriol large. 326A acid attack, 326B acid attack. Now, now listen, you will understand by some very simple question and answer, then you will understand. Okay. See, simple question पूछूंगा. Simple. X fired on Y. Okay. Y survives. Which IPC will be applicable on X? Punishable under which IPC? X fired on Y, Y survives. Anyone? 307. It is attempt to murder. Ma'am, Damodaran, you have written 324. Okay, you have written 324, but I have not mentioned anything about the injury. If I would have mentioned about the injury, now listen. X fired on Y. X fired on Y. There is a bullet scratch on skin on Y. Which IPC will be applicable? Then you should have written 324. Bullet scratch, yes, then it would be 320. But I have not mentioned anything. Yes. If agar मैं बोलता हूं X fired on Y, bullet is inside the abdomen, which IPC will be applicable? And person survives. Person survives also. So two IPC will be there. 307 as well as 326. 307 as well as 326. Are you getting my point? Okay. X punched on face of Y. Y got fracture of tooth. Which IPC will be applicable? Fracture of tooth. 325. Why? It's a non-dangerous weapon leading grievous hurt. Non-dangerous weapon leading grievous hurt. Okay. Voluntarily causing grievous hurt is defined under which IPC? Voluntarily causing grievous hurt defined under which IPC? Definition. Grievous hurt. 322. It is simple at is 321. It is in sequence. Simple at, grievous hurt, voluntarily causing simple at, voluntarily causing. It is in sequence. It is in sequence only. Torture comes under which IPC? Torture. 330. 330. Torture. If mother is not giving consent and husband and in-laws family is going for criminal abortion, doctor and in-laws family and husband are punishable under which IPC? Yes, it is 313. 313. Very good. Dowry death is punishable under which IPC? Dowry death. Dowry death. B. Bahu, bride. Doctor, mental torture to the wife is punishable under which IPC? Mental torture to wife is punishable under which IPC? Dharini, 498A. Okay, Dharini, I have already discussed three vitriolas, 326A and 326B, acid attack and acid attempt. 3 लड़कों ने 2 लड़कियों पे छिड़क दिया एसिड. ये तो ऑलरेडी डिस्कस हो गया ना? Already discussed. Vitriolas. I think I explained everything in a very simple way. You should remember all these. Grievous, that is 320. Voluntarily causing simple and grievous are 321 and 322. Punishment are simple hurt by non-dangerous weapon, 23. Grievous, simple hurt by dangerous weapon, yes. IPC 44, 45, 46 is definition of. यार क्या करते हो तुम? I already told you these are definition of injury, life and death. These are definition of injury, life and death. Injury is defined under this, life is defined under this definition. Death is defined under this. IL. This is a trick to remember. Okay, done. ILD is a trick. It is a trick to remember. Interstitial lung disease, injury, life and death. It is in sequence 44. 320 and 326 में क्या difference है? Sanu, 320 is a definition of grievous hurt. 320 is a definition of grievous hurt. 326 is a punishment of grievous hurt by dangerous weapon. 320 is a definition of what are the grievous hurt we discuss in 320. What are the punishment of grievous hurt we discuss in 325, 326. Okay. Anything else? Okay. What is grievous hurt we discuss in 320, and what are the punishment of grievous hurt we discuss in 25 and 26, 325 and 26. Okay. Now see. So what are the type of torture we have? What are the type of torture we have? Actually, sir, torture was first defined whenever I write down D, that is definition, in Tokyo. And for torture patient treatment, Istanbul. Treatment of torture patient was Istanbul. That is examination of torture patient was given in Istanbul. So you can remember, it's a very simple trick. T for torture, T for Tokyo. It is Istanbul. Treatment of tortured patient. Treatment or examination of torture. Now, sir, what are the type of torture? Types of torture. Most common torture is beating. If you are beating someone, this is the most common torture. Sir, where are you beating? Sir, beating on soul. This torture is known as phalanga. Sir, phalanga is also known as bastinado. Beating on soul, it is known as phalanga. Phalanga is also known as bastinado. Quirafona. Quirafona is beating on abdomen. Beating on abdomen is quirafona. Quirafona. Beating on soul. Beating on ear or slapping on ear. Sir, it's very simple trick. On ear we use telephone, that becomes telephona. Telephone, it becomes telephona. So again, I'm revising, my dear friend. Beating on soul is phalanga. Beating on abdomen is quirafona. Beating on ear is telephona. Telephona. That's very simple trick here. Now, sir, long standing. It means if you are torturing a person for a long standing for long hours, very simple trick, planton. L for long standing, L for planton. That's a very simple trick. Picana. Picana has IC. It is electric torture. Electric also has IC. If you are electric torture is you are giving, that's a very simple trick. But sir, electric torture on genitalia. अगर आपने किसी के genitalia पे electric torture कर दिया, that is known as cattle pod. अगर आपने किसी के genitalia पे electric torture कर दिया, that is known as cattle pod. That's a very simple trick. PIC, PIC, electric IC. Long standing, L, L for planton. That's very simple. Long standing. Sir, chili powder in anal canal. Chili powder in anal canal. It is known as Bellery. It is known as Bellery. अगर किसी के पिछवाड़े में आपने मिर्ची का पाउडर डाल दिया, चिली पाउडर, चिली पेस्ट. Hot metallic rod. Hot rod in anal canal. It is known as black slave. It is known as black slave. Hot rod in anal canal. it is known as black slave. Black slave. Yes. Plastic bag suffocation. If you are applying plastic bag surrounding the neck and that is creating suffocation, this is known as dry submarine. This is known as dry submarine. Plastic bag applied surrounding the neck. This is known as dry submarine. Dry submarine. Plastic bag suffocation. Now, last two torture. One is Palestinian hanging. One is Palestinian hanging. Second is jackknife position. One is Palestinian hanging. Second is jackknife position. Sir, in both torture, trachea is compressed. Trachea is compressed. And a person dies due to positional asphyxia. In both conditions, trachea is compressed and person dies due to positional asphyxia. Positional asphyxia. Now, Dr. Saab, in these conditions, what happens actually? Trachea comes in front. This is trachea comes in front. There is a pressure on trachea. So these are two torture: Palestinian hanging and jackknife position. In both conditions, trachea gets compressed and person died due to positional asphyxia. Person dies due to positional asphyxia. This is known as jackknife position and Palestinian hanging. Dr. Sir, you can get a question. In these two conditions, person dies due to what? What asphyxia? This is positional asphyxia because of trachea gets compressed. Neck get compressed. So what are the name of these two positions? Now, Dr. Sir, मेरे साथ थोड़ा revision कर देना. Slapping on the ear is known as ear telephona. Beating on abdomen is known as queeraphona. Electric torture is known as, अरे torture is a different thing यार. Torture means you are torturing. आपने किसी को पकड़ के मार रहे हो तो उस पर ग्रीवियस एड भी लगेगा, बहुत सारा आईपीसी लगेगा. छोड़ दो उस चीज को. Cattle pod on genitalia. Genitalia it is cattle pod, otherwise it is a picana. Okay. Which two torture causes positional asphyxia? Two torture causes positional asphyxia. Jackknife and Palestinian hanging. Yes, इन दोनों में ट्रेकिया पे कंप्रेशन होता है. Long standing, for standing for long hours, which torture? For standing for long hours, which torture? Plankton. This is plankton. Yes, absolutely right. It is plankton. Very good. It is plankton. Long standing is plankton. Long standing is plankton. Okay. So anyways, sir, these are the tortures. Plastic bag suffocation. What's the name of this torture? Plastic bag suffocation. Yes, let me see your answer. Plastic bag suffocation. It is dry submarine. Very good. Dry submarine. If you are applying plastic bag and the person is getting suffocated, this is known as dry submarine. Very good. Beating on sole is known as. Yes, it is phalanga. It is phalanga or bastinado. Very good. It is phalanga or bastinado. Very good. Now, sir, there is a relation between trauma and growth. There is a relation between trauma and growth. Sir, this relation was given by Ewing. This is known as Ewing postulate. This is known as Ewing postulate. Relation between trauma and growth. This is known as Ewing postulate. Now, sir, after injury, there are certain enzyme marker of injury. And sir, this question comes. These enzyme marker was discussed by Raikilo. So, enzyme marker of, so you can get two questions. Ewing discussed the relation between trauma and growth, and enzyme marker was first discussed by Raikilo. Now, this question comes, which is the first enzyme marker after injury? Which is the first enzyme marker? You can remember by a trick, TSH. T comes first, tissue cathepsin. Tissue cathepsin, then serotonin, then histamine. This is the sequence. First comes tissue cathepsin, then comes serotonin, then comes histamine. These are three enzyme markers, and there are 6 or 7 types of, but sufficient for MCI. This is the first enzyme marker. This is tissue cathepsin, then comes serotonin, and sir, then comes, yes, histamine. First enzyme marker is tissue cathepsin. These all enzyme marker were discussed by biochemical marker discussed by Raikilo. तो आपको दोनों साइंटिस्ट के नाम याद रखने हैं. One is Ewing, second is Raikilo. Ewing and Raikilo. Now, sir, this is all about, we have discussed some type of IPCS injury. Now I am coming to, sir, postmortem techniques. Next question is postmortem techniques. Postmortem technique. चलो मैं आपसे सवाल पूछता हूँ. I'll ask you a question. Who discuss the relation between trauma and new growth? Ewing. And who discussed the enzyme marker after injury? Enzyme marker after injury? Raikilo. Which is the first enzyme marker increase after injury? Tissue cathepsin. Very good. Tissue cathepsin. Tissue cathepsin. Now I am coming to, sir, postmortem techniques. Sir, we will start the postmortem techniques. Sir, postmortem is also known as autopsy. Postmortem is also known as autopsy. See, what are the type of incision we use for autopsy? Incision are I shape, Y shape, I shape, Y shape, modified Y shape, and inverted Y shape. Like, so this is the I shape, simple. Most common is I shape. Y shape is generally used in female. Modified Y shape is used in hanging and strangulation. And sir, inverted, IN is inverted. It is used in IN for infant. Look, sir, these are 4 types of incision. This is I shape. That's a very simple I. Y. In Y, actually, what we do, the female breasts are not involved. That is a Y. It's a Y shape, so that we can retain the female breast. That is a Y shape. Modified Y shape is done in hanging and strangulation. Inverted, how to remember? IN for inverted and IN for infant. That's very simple. These are incision method. Most common is I shape. Y shape, modified Y shape is done in hanging and strangulation. Inverted in. That's very simple. Now, sir, what are postmortem techniques? Okay. 4 methods, 1, 2, 3, 4. First is Rokitansky, second is Virchow, third is Gons, fourth is Litul. Gons. Now, sir, how to remember? See, Rokitansky method, these all are method of postmortem for organ removal. See, Rokitansky has I and N. This is a in situ method. Rokitansky has I and N. This is a in situ. What is the meaning of in situ? We are not taking any organ out. We are dissecting inside. That is in situ. In situ means inside. So it is in situ IN. It is done in infant only. This is also IN. So Rokitansky is in situ. It is done in infant. Okay. Gons, it is a blog method. How to remember, sir? You can remember. Blog, I can write down blog. Blog is G for Gons. Blog. What are the block? We are taking cervical block out, thoracic block out, pelvic block out, means cervical organ different, abdominal organ different. These are the block taken out. This is known as Gons method. But sir, if we are taking all these out simultaneously, this is en masse method, large. देखो डॉक्टर साहब, what I'm telling you, just अब मैं आपको सवाल पूछता हूँ. Okay, I'll ask you a question, then you'll get this. Sir, I am taking one by one organ out in postmortem. What is the name of technique? One by one organ out. This is the most common technique, Virchows. Yes, Virchows. I am not taking any organ out. I am dissecting inside the cavity only. What is the name of the technique? Rokitansky. Rokitansky. Very good. I am not taking any organ out. I am not taking any organ out. I am taking blocks of the organ out. What is the name of the technique? Blocks of the organ out. Gons technique. I am taking all the blocks simultaneously out at the same time. This is what is the name of technique? Yes, Litul. I think you all understood in a very simple manner. Are yes or no? Are yes or no, Janu? हैं भाई?
Yes, sir.
ओके, मतलब देखो, हम एक एक करके सामान निकालते हैं, कुछ सामान नहीं निकालते हैं, बड़े बड़े ब्लॉक में सामान लेते हैं, सारे ब्लॉक को एक साथ इकट्ठा निकाल देते हैं. दीज आर 4 टेक्निक्स. अरे यस और नो? ओ भाइयों और बहनों, जानू, लव यू भाई. अरे समझ में आ रहा नहीं आ रहा? चलो, समझ में आ रहा? बिल्कुल ऐसा आना चाहिए साला, जिंदगी में कभी भूलो ना. ओके ओके, बस बस, अरे बस 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 बस, अरे बस बस बस, है ना? Okay, now sir, when we conduct postmortem, we dissect organ. Write down dissection of organ. Now sir, if we are dissecting spinal cord, we dissect it posteriorly. Spinal cord is dissected posteriorly. If we dissect stomach, we open the stomach from greater curvature. This was a question. We open the stomach from greater curvature. If we open heart, first we open right atrium, then we open right ventricle, Then we open left atrium and then left ventricle. Left ventricle. Spinal cord posteriorly. Stomach is opened from greater curvature. Then we open heart. Yes, I discussed this on heart. How do we open the heart? We have discussed right atrium, right ventricle, left atrium, left ventricle. This is the way open we heart. Now, sir, generally, which is the first cavity to be opened and which is the last cavity to be opened? Which is the first cavity to be opened? Which is the last cavity to be opened? Sir, in routine autopsy, we can open thorax, head, any one. But generally, in poisoning cases, first we open head because, sir, the best smell of the poison comes from brain. Last doesn't matter. In poisoning cases, first we open head in poisoning cases. In asphyxial death, this is a very important MCQ according to me. In asphyxial death, first we open cranium, that is head, same head. Last we open neck because we want neck as a bloodless field. We want neck as, as a bloodless field. So poisoning, first we open head. Asphyxial death, first we open cranium, then neck. Last open is neck. Last we open neck. Yes, in poisoning case. In infant, a child below 1 year of age, we open first as an abdomen. First as an abdomen. Last doesn't matter in infant. In air embolism, first we open brain. Last doesn't matter. In air embolism, first we open brain. Last doesn't matter. Now in head injury, first we open head. Last doesn't matter. So there are some criteria what should be opened first and what should be opened last. But sir, in pulmonary air embolism, first we open thorax. In pulmonary air embolism, first we open thorax. And doctor, what we do? We open the thorax, fill this thorax with water, and we do water test. If any air present, there will be formation of bubble. If any air present, there will be formation of bubble. This is known as water test. Last doesn't matter. And for pulmonary air embolism, we also do pyrogallol test. We also do pyrogallol test. Yes, this is for pulmonary air embolism. Anyways, sir, थोड़ा revise कर लेते हैं. What is the first cavity to be opened in asphyxial death? Asphyxial death, what is the first cavity to be opened? What is the first cavity to be opened? Yes, it is cranium. What is the last cavity to be opened in asphyxial death? Neck. Actually, sir, why do we open it last? Because we want bloodless field. We want bloodless field of the neck. In head injury, which is the first cavity to be opened? First cavity to be opened. Head. Air embolism, which is the first cavity to be opened? Brain. Head. It is same head. Poisoning cases, which is the first cavity to be opened? Brain. Again, same head. right?
थोड़ा सा पेज ऊपर करोगे, थोड़ा सा
Yes.
पेज ऊपर करोगे, मतलब स्क्रॉल अप करोगे,
कितना ऊपर करूं?
बस और तो
प्लस
और थोड़ा सा बस,
और
हाँ बस हो गया, ठीक है, हो गया सर, आप
हो गया.
हो गया.
So what are actually in pulmonary air embolism? What do we open first, sir? What do we open first? It's very simple. We open first thorax. We fill this thorax with water and we puncture the capillary. If bubble is there, it is a water test. And for pulmonary air embolism, we also do pyrogallol test. Pyrogallol test. Pyrogallol test. Yes. Now, sir, very important word comes. Medico-legal autopsy. Type of autopsy. Yesterday we discussed what is medico-legal autopsy, which is done as a medico-legal case and done by police or magistrate request. Like any murder case, any suicide case, any unnatural death, sir, there is medico-legal autopsy. Like Sushant case was a very simple example of medico-legal autopsy. Now, sir, pathological autopsy. Pathological autopsy. Pathological autopsy. Sir, here for cause of death, we do pathology. Here for cause of death, we do pathology of the organ. And here consent is given by relative. Without consent of relative, we cannot go for pathological autopsy. It is academically oriented. It is academically oriented. Academical oriented. We start from eye or orbital. First incision, we start from eye or orbital. No, it is taken like as a sagittal section like this. Sagittal section from frontal area. This is known as academically oriented pathological autopsy. Now, psychological autopsy. So psychological autopsy, same thing which happened with Sushant Singh Rajput. What is psychological autopsy? Sir, in suicide cases, we ask question to family member or friends, and we want to know the mental status of a person at the time of suicide. We ask question from family member and we want to know the mental status of a person. This is known as psychological autopsy. Virtual autopsy. Virtual autopsy, cause of death by non-invasive method. Cause of death by non-invasive method. What are the non-invasive method? CT scan, MRI, X-ray. CT scan, MRI or X-ray, if we are using these non-invasive method, this is known as, yes, this is psychological. This is known as virtual autopsy. Virtual autopsy. So we have discussed medico-legal on the request of, yes, on the request of police and magistrate. It has a medico-legal autopsy. Pathological autopsy on the relatives' consent. Psychological autopsy, we are asking question to the family member and friends. Virtual autopsy is cause of death by non-invasive method like CT, MRI or X-ray. Now I am coming to, sir, very, very important word, that is negative autopsy. Sir, after postmortem, you are going for lab investigation, toxicological analysis, histopathological analysis. Sir, even after all these, there is no cause of death. This is known as negative autopsy. Example, yes, sir. If the person dies due to vagal inhibition, if person dies due to vagal inhibition, laryngeal spasm, sir, these are not detectable in postmortem lab diagnosis, toxicology, or histopathology. Sir, this is known as negative autopsy. 2 to 5% autopsy are negative autopsy. 2 to 5% autopsy are negative autopsy. Negative autopsy. Even in gross finding, you cannot get anything. In gross finding, you cannot get anything. After postmortem lab toxicology, this is negative autopsy. But sir, sometime a question comes, obscure autopsy. Obscure autopsy. What is obscure autopsy? What is obscure autopsy? So like a person had a head injury. There is a bruise on head. There we have bruise on head, a small bruise on head, and person died due to head injury. Bruise on head is a minimal finding. Minimal finding. Bruise on head is minimal finding, but sir, in postmortem examination after dissection, no other finding detected. No other finding. There is no hematoma in the brain, no extradural hematoma, no subdural hematoma. Sir, this minimal finding in the brain, this is a bruise on the head. This suggests that person died due to a head injury. But sir, in postmortem, we are not able to get any other finding. Sir, this is known as obscure autopsy. Minimal finding is present, but not the significant finding is present. This is known as obscure autopsy. You have minimal finding in postmortem examination, but in gross examination, you are not able to detect anything. This is known as obscure autopsy. Obscure autopsy. This is known as obscure autopsy. So this is a very, very important word. What is obscure autopsy? Yes, we discussed. This is known as obscure autopsy. Okay, friends. So मैं आपसे कुछ सवाल पूछता हूँ. CT, MRI, and X-ray, we are detecting the cause of that. What's the name of that autopsy? Virtual. Yes, it is virtual autopsy. Yes, this is virtual autopsy. Absolutely right. Virtual autopsy. CT, MRI, and this is virtual autopsy. After postmortem, after lab investigation, after histopathology, after toxicology, we are not able to decide the cause of death. Which autopsy is this? Negative autopsy. You have minimal finding in postmortem without significant finding of cause of death. What's the name of this autopsy? Obscure autopsy. Psychological autopsy is done in homicide, suicide, accidental, all. Yes, it is done in suicide. Psychological autopsy is done in suicide. Suicide only. In which autopsy consent of relatives are must? Pathological autopsy. Consent of relatives are must in pathological autopsy. Stomach is opened from greater curvature. Greater curvature, very good. Stomach की opening greater curvature के through होती है, very good. Okay. Spinal cord is, अशोक मेरे को नहीं मालूम मर्डर है या सुसाइड है, मैंने ना तो उसका पोस्टमार्टम किया ना मैंने कुछ किया, कुछ आइडिया नहीं. Spinal cord is opened from which approach? Posteriorly. Sir, there is a word which is known as postmortem fracture of C6, C7 vertebra. Sir, it is known as undertaker fracture. Postmortem fracture सर हर पोस्टमार्टम में कॉज देखते हैं तो क्या हर ऑटोप्सी पैथोलॉजिकल होती है क्या? अरे यार डॉक्टर साहब, what is pathological autopsy? I am telling you. Medico-legal autopsy can be a pathological autopsy, but pathological autopsy cannot be a medico-legal autopsy. Yeah. If I am conducting postmortem on the request of police and magistrate, I can go for histopathology. But if only like someone got cardiac arrest, we know the cause of death, the person is cardiac arrest, and the relative wants or academician wants the cause of death after examination of heart, this is known as pathological autopsy. So medico-legal autopsy में हम पैथोलॉजी कर सकते हैं, लेकिन पैथोलॉजिकल ऑटोप्सी कभी भी मेडिको-लीगल नहीं होती है. Pathological autopsy, if relative wants, they can go for pathological autopsy. Anyways, sir, this is all about autopsy. Now I am coming to, sir, injuries. Different type of injuries. Different types of injuries. What are the types of injury we have? What are the name of injuries we have? Types of injuries. First, write down. Yes. First, we'll discuss little bit simple injury, like what are these injuries? Thermal injuries. This is simple topic, thermal injuries. Thermal injuries, yes sir. What is hypothermia? Thermal injuries. Hypothermia. Hypothermia is temperature below 35 degrees centigrade. What is hypothermia? Temperature below 35 degrees centigrade. It is known as hypothermia. So in hypothermia, we have two types of hypothermia. One is frostbite. A hypothermic injury, this is known as frostbite. Second is known as trench foot. Trench foot is also known as immersion foot. Trench foot is also known as immersion foot. Now, Dr. Saab, this frostbite is seen. This frostbite is seen when you have extreme cold temperature, minus 2.5 degrees centigrade, and trench foot is seen when you have temperature of 5 to 8 degrees centigrade. These are two types of hypothermia, frostbite and trench foot. Frostbite and trench foot. These are two types of hypothermia. Now, sir, if any person died due to hypothermia in postmortem examination, Doctor, you can get this question. Vishnuyevsky spot in stomach mucosa. You can get this question. Vishnuyevsky spot in stomach mucosa. This is a very, very important MCQ. In postmortem examination of dead body due to hypothermia, you can find Vishnuyevsky spot. Vishnuyevsky spot. डॉक्टर साहब ये मेरा बहुत ही अच्छा क्वेश्चन है, मेरे को लगता है ये कभी ना कभी आएगा कि Vishnuyevsky spot are seen in which death? Hypothermic death. Vishnuyevsky spot are seen in hypothermic death. Now, sir, other finding which can be seen in hypothermia, other finding erythema pernio. Sir, a specific erythema where skin become red in hypothermia, this is known as erythema pernio. Erythema pernio. Another important finding of hypothermia, paradoxical undressing. Sir, generally, what happens in hypothermia? The temperature is low. The person to protect should be dressed, but sir, because of some disturbance in the mental status, the person undresses himself or herself. This is known as paradoxical undressing. Paradoxical undressing, undressing of the person. And hide and die phenomena. Hide and die phenomena. Sir, actually, these are the questions which can be asked in PG level according to me. But sir, you should remember, again, I'm revising, my dear friend. Redness of the skin is known as erythema pernio. Undressing of the person is known as paradoxical undressing, and hide and die phenomena. The person hide himself. This is known as hide and die phenomena. But sir, the best question I'm finding here is Vishnuyevsky spot in stomach mucosa if the person dies due to hypothermia. Vishnuyevsky spot. Vishnuyevsky spot. Very, very important MCQ. Now I'm coming to sir, hyperthermia. Sir, whenever temperature of the body increases, sweating gets activated. Whenever temperature of the body increases, that is in hyperthermia, sweating gets activated. Now, sir, I'm coming to three types of hyperthermia. First is heat cramp. First is heat cramps. So actually, you are in heat and you are having muscle cramp. This is known as heat cramp. These are also known as fireman cramp. These are also known as fireman cramp. Fireman cramp or miner's cramp, because the people who are working in mine, there may be cramps. These are actually muscle cramp. What happens, sir? If I'm working in some heat, what will be there? There will be increased sweating. Yes, sir. There will be increased sweating. Due to increased sweating, the water and electrolyte are lost. There will be increased sweating. Water and electrolyte are lost. That will produce muscle cramp. This is known as heat cramp. So, sir, if you get a question, sir, in heat cramp, we have increased sweating. In heat cramp, we have increased sweating. Second, sir, heat stroke, which is also known as sunstroke, heat hyperpyrexia, and thermic fever. What is this? All are seen. Sir, actually, this is seen when you are working in sunlight, like I have mentioned, sunlight, humidity, increased temperature, sunlight, humidity, infection. Sir, what happens? When your temperature goes when your temperature goes above 41 degrees centigrade. When your temperature goes above 41 degrees centigrade, sir, this sweating, yes, this sweating is absent or stopped. This condition is known as heat stroke. This sweating is absent or stopped. Dr. Saab, this is known as heat stroke. In North India, it is also known as loo lagna, loo. And sir, here person goes in delirium and pupil is dilated. Person goes in delirium and pupil is dilated. This condition is known as heat stroke. Doctor, in first condition, sweating is more. In second condition, sweating is absent. Sweating is absent. Now, third condition. Third condition, yes. Third condition is heat prostration. Heat syncope. Or heat exhaustion. Heat prostration, heat syncope, heat exhaustion. What happens, sir? If you are going in a very high temperature, like you are going in 80 degrees centigrade temperature, sir, you get vascular collapse. And friends, here you got vascular collapse, no increase in the temperature, even sweating is not activated. Even sweating is not activated. Sir, I would use three words. Sweating is more leading muscle cramp, is a heat cramp. Sweating is activated, but after 41 degrees centigrade, sweating is stopped, it is a heat stroke. And you got vascular collapse at a very high temperature. Sir, sweating is not activated, temperature is not increased, that is a heat syncope. Most common is heat stroke in India. Most common is heat stroke. Now, Dr. Saab, I'm putting some question, then you will realize, okay? Okay. Okay. Now, sir, see, if a person is working in sunlight, in increased humidity environment, having infection, and suddenly person goes in unconscious state, pupil is dilated, what is the mechanism of this condition? Sweating. What is the mechanism? Sweating activated, not activated, sweating stopped. What is the mechanism?
Sweating
Stopped. After activation, it got stopped. What is the name of this? What is the name of this condition? What is the name of this condition? Heat stroke. After heat, if muscle gets cramped. Now, second question. At what temperature, when temperature goes above this temperature, the person get heat stroke? What is the temperature, that temperature? 41 degrees centigrade. Yes. If after extreme heat, person gets vascular collapse, this condition is known as heat syncope. Yes, syncope. Here sweating is activated, not activated, or absent. Sweating is not activated. In heat stroke, pupil is dilated or contracted. Yes, it is dilated. So, looks like you can get some question regarding these thermal injury. I just cleared the concept. If muscle cramps are there, this is heat cramps. If sweating is absent, this is heat stroke. And if, sir, sweating is not activated, you got vascular collapse due to extreme condition. This is yes. Now, sir, the next thermal injury is burn. Everyone knows burn is application of heat. Burn is application of heat. Yes, absolutely right. Burn is application of heat. Now, sir, for skin producing burn symptom, now at what temperature you feel burn? When temperature is 44 degrees centigrade, you feel burning symptom temperature. Now, sir, dupuytren classified burn in 6 category. Dupuytren classified burn in 6 category. But no, we are not following Dupuytren classification, sir. We are following Wilson classification. We are following Wilson classification. Wilson classified burn in 3 degree. First degree, second degree, third degree. First degree is epidermal burn. Second is dermoepidermal burn. And third degree is deep burn. Epidermal, dermoepidermal, and deep burn. Sir, most painful burn are dermoepidermal. Deep burn are relatively painless. There is less pain because nerve endings are lost. Because nerve endings are lost. Most painful burn are dermoepidermal. Deep burn are relatively painless because nerve endings are lost. So anyways, sir, this is the first burn, epidermal. Second is dermoepidermal. Third is deep burn, third degree burn, which are relatively painless. Relatively painless. Yes. Now, sir, most common cause of death is hypovolemic shock. Hypovolemic shock. That is the most common cause of death. Is hypo.
Excuse me, sir.
Yes.
Is it not septicemic shock?
Hypovolemic shock.
Okay.
Most common cause of death is hypovolemic shock. Change this if you have written in any class as this. Hypovolemic shock. Screen is visible? Screen is visible?
Yes, sir.
There. Okay. Hypovolemic shock. Most common cause of death in acute burn is neurogenic shock. Most common cause of death is hypovolemic shock. And second is most common cause of death is neurogenic shock. Acute burn. Acute burn. If you die immediately, that is acute.
Excuse me, sir.
Yes.
Sir, सर्जरी में septicemic shock लिखवा रखा है most common cause of death in burn.
किसने लिखाया?
सर आपने पिछली बार क्लास दी थी तो सेप्टिक
मैंने तो पिछली बार ली तो मैंने चेंज कर दिया. समझ रहे हो मेरी बात?
ओके.
मैंने तो चेंज कर दिया ना. तुम्हें सर्जरी में किसने लिखाया?
सर मैं तो विनीत सर के नोट्स पढ़े थे.
चेंज कर लेना.
ठीक है, थैंक्स.
एक्चुअली मैंने भी जब चेंज किया है तो किसी से कंसल्ट करके ही किया होगा. मैंने भी पिछले साल सेप्टिक शॉक ही लिखाया था.
ब्रेड प्लेटर में भी सेप्टिसिमिया दिया हुआ सर.
हैं?
ब्रेड प्लेटर में भी सेप्टिसिमिया दिया हुआ सर.
हाँ दिया हुआ, लेकिन मैंने किसी सर्जरी से फैकल्टी से कंसल्ट किया. मैंने भी पिछली साल सेप्टिसिमिक ही लिखा था, लेकिन मैंने कहा ज्यादातर केसेस में देखो एक्चुअली इसका कारण है यार. देखो what is the most common cause of death? There is a fluid loss is a very common cause of death, and fluid loss is because of hypovolemic shock. Fluid loss leads to septicemia is a secondary cause when the person gets infected. है ना? Person gets infected. So shock due to fluid loss is a hypovolemic shock. Shock due to fluid loss is a hypovolemic shock. Acute cause of death is neurogenic shock. That is right, no doubt. Now body surface area, BSA, body surface area. For body surface area, yes sir, excessive loss of fluid and dehydrated body, yes. Yes. Body surface area to calculate Wallace rule. And sir, Wallace rule is rule of 9. Wallace rule is rule of 9. Now sir, what is this rule of 9? Yes, you can see. It's a very simple rule of 9. This area is 9%. This area is 9%. This area is 9. This area is anterior 9 and posterior 9. This area is anterior 9 and posterior 9. Same. This area is anterior 9 and posterior 9. This area is anterior 9 and posterior 9. So we can see there are 11 9. This is 99. You can see this, there is no anterior posterior, only 9. Then you can remember this. Anterior 9, posterior 9, anterior 9, posterior 9. There are 11 9 I have written. Okay. 1% is for genitalia. This is known as rule of 9. But sir, if you want to go in further detail, if you see the upper limb, like this is the upper limb. This is hand. You can remember this is 4. This is, if you want to differentiate, 5, 4 or 4, 3, 1 or 5, 4, 1. You can remember 5, 3, 4, 3, 2. 5, 4, 3, 2. That's the better way. 5, 3, 1, 5%. This one. 3, 1, 1%. This is 1%. 4, 3, 2. It may be 4, 3. If we divide 9, if we divide 9%. But anyway, sir, this is for upper limb. This is, and there is one more area for lower limb. But for your examination point of view, you just remember this is 9, 9, 9, 2 more 9, 2 more 9, 9, 9. There are 11 9. This is Wallace rule. This is Wallace rule. Wallace rule. Now, sir, there is one more formula which is known as Lund and Browder formula. Lund and Browder formula. What is Lund and Browder formula? Head, thigh, and leg. Head, thigh, and leg constitutes 40%. All remaining part is 60%. This is known as Lund and Browder formula. This is known as Lund and Browder formula. Lund and Browder formula. Head, thigh, and leg constitute 40%. Remaining contain 50%. 50%. This is Lund and Browder formula. No, infant पे अप्लाई नहीं होता है. Infant के लिए अलग फॉर्मूला होता है. Percentage of infant are little bit different. वो आपको pediatrics में पढ़ाएंगे थोड़ा सा. Lund and Browder formula. This is also different. Head, thigh, and leg. It is 40%. Remaining area are 60%. Remaining area are 60%. Now, rule of palm. Rule of palm. Palm covers 1% body surface area. your palm covers 1% body surface area. This is known as rule of palm. Now, sir, a very important MCQ comes. How to differentiate? चलो थोड़ा रिवाइज कर लेते हैं. What is the name of rule of 9? क्या बोलते हैं इसको rule of 9 को? What is the name of rule of 9? Wallace rule. Wallace rule. In Lund and Browder formula, which area constitute 40%? Lund and Browder formula, what area constitute 40%? Head, thigh, head, thigh, and leg. What is the most common cause of death in burn? Hypovolemic shock. What is most common cause of death in burn, in acute burn? Neurogenic shock. Vishnuyevsky spot seen in which organ? Vishnuyevsky spot seen in which organ? Stomach mucosa. Stomach mucosa. Which condition? Which condition?
Sir,
Hypothermia. Hypothermia. In burn, feeling of the symptom comes when the temperature of burn is around or more than 44 degrees centigrade. Heat stroke is seen when temperature goes beyond 41 degrees centigrade. In heat stroke, sweating is activated, not activated, stopped.
Stop, sir, stop.
Stopped. Paradoxical undressing phenomena is seen in hypothermia, hyperthermia, burn, hypothermia. Arrhythmia pernio is seen in burn, hypothermia. Now, what is the table? How to differentiate antemortem burn from postmortem burn. So here I am writing down antemortem, here postmortem. How to differentiate antemortem? Antemortem means before death. Antemortem means before death you have burned. Postmortem means after death you have burned. Before death you have burned. How to differentiate? Heat syncope, when you enter in 80 degrees centigrade, you get vascular collapse, sweating is not activated. Now, antemortem burn before death, postmortem burn after death. Now, sir, if it is before death, red line present, inflammation line present, it is absent. Vital reaction present, it is absent. Enzymatic reaction may be positive, may be negative, present, absent. Positive or negative enzymatic reaction, present, absent. Blister may be present in both. Red line present in antemortem burn, vital reaction present in antemortem burn. Enzymatic reaction is positive or negative present in antemortem burn. Blister present in antemortem burn as well as postmortem burn. But sir, this blister contain protein and chloride, and this blister of postmortem burn contain air. This blister of antemortem burn contain protein and chloride. This blister contain this. Now, sir, smoke. Sir, smoke has two effects present in antemortem burn. Number one, carbon monoxide, because smoke contains carbon monoxide. Carbon monoxide level of the blood in antemortem increases. It is normal in postmortem burn, because after death, never carbon monoxide inhales inside the trachea. So it is only elevated in antemortem burn. Second, so smoke has carbon particle. Carbon particle, which are also known as soot particle, carbon particle, which are also known as soot particle. These are present in trachea. These are never present in trachea. And observe, this is the most characteristic finding of antemortem burn. This is the most characteristic finding of antemortem burn, carbon particle or soot particle present in trachea. Carbon particle or soot particle present in trachea. Now, sir, sometime you get a question. In what way you can get a question? You got a burnt body. The blister of the burnt body contain albumin plus chloride. What is the diagnosis? It is antemortem burn or postmortem burn? Albumin plus chloride? It is antemortem burn. Soot particle or black particle, carbon particle present in trachea is the most characteristic finding of soot particle or carbon particle in trachea is the most characteristic finding of, yes, antemortem burn or postmortem burn?
Antemortem.
Yes, it is antemortem burn. Most characteristic, best finding of antemortem. Now, positive and negative enzymatic reaction present in antemortem burn, postmortem burn, both, none. Positive and negative enzymatic reaction present in antemortem burn. Yes. So there may be positive means increase, there may be negative, but the positive and negative, these finding. Carbon monoxide level of the blood increases in antemortem burn or postmortem burn?
Antemortem.
Yes. So these are the questions you can get regarding antemortem burn and postmortem burn. But sir, now there is one finding which is seen in antemortem plus postmortem burn both. Antemortem plus postmortem burn both, one finding. This is known as pugilistic attitude. Pugilistic attitude. Sir, pugilistic attitude is also known as boxing attitude or fencing attitude. Pugilistic attitude is known as boxing attitude and fencing attitude. Sir, what happens? Sir, mechanism, what happens? Your body is burning, doesn't matter it's antemortem burn or postmortem burn. What happens? There is coagulation of muscle protein. There is coagulation of muscle protein. This coagulation of muscle protein, due to this, it is causing contraction. Whole body is contracted. Contraction of muscles. Now, whole body is contracted or shrinked. This shrinkage of the body is known as pugilistic attitude. It is pugilistic attitude. This is known as, this is seen in antemortem burn as well as postmortem burn. This is seen in antemortem burn as well as postmortem burn. I will show you this picture in Google. It's not in my images or slides because it's very simple. The whole body is contracted. The whole body is contracted. Just get the snapshot of this picture. Pugilistic attitude. Pugilistic attitude, it is seen in antemortem as well as postmortem burn. This is seen in antemortem as well as postmortem burn. Now I will show you, this is a very good picture, you can see. This is contracted picture. Yes, this is a better picture, this one. You can see. You can see this whole body is contracted, shrinked. This whole body is contracted, shrinked. This is pugilistic attitude. Or you can see another picture. This is another picture, contracted picture. Contracted burn picture. Yes, this is another important. Yes, This is pugilistic attitude. Can you see the picture? This is a contracted body posture known as pugilistic or fencing or boxing attitude. Pugilistic or fencing or boxing attitude. Contracted picture. Okay, anyways. This question comes, this picture can also come in exam. What now? Tell me, what is the mechanism of pugilistic attitude? What is the mechanism of pugilistic attitude? What is the mechanism of pugilistic attitude? Coagulation of, yes, coagulation of muscle protein. Coagulation of muscle protein. Now, sir, in burn, yes, coagulation of muscle protein. Now, sir, in burn, we have heat rupture. In burn, due to this heat, we have heat rupture. Sir, it is a muscle rupture. Like, see, due to heat, this is a muscle. Inside the muscle, we have excessive heat. This causes rupture. This is known as heat rupture. The margins are irregular. Irregular margins are seen in heat rupture. And Dr. in the floor of heat rupture, blood vessel and nerves, these are intact. Blood vessels and nerve, these are intact. This is known as heat rupture. Irregular margin, heat rupture. Now, sir, come to the second. This is thermal fracture. Sir, due to heat, we have skull bone fracture. Due to heat, we have skull bone fracture. See, this is skull bone, and there is a fracture from inside. This is known as thermal fracture. Thermal fracture. Sir, thermal fracture can cross suture line. Can cross suture line. Sir, in the last class, I mentioned it never crosses suture line, but sir, it can cross suture line and seen on one side. So it can cross suture line. In last class, which I took for forensic, I told you it never crosses suture line. Sir, it can cross suture line. It can cross suture line, thermal fracture. There is a correction. And the last is heat hematoma. Heat hematoma is a hematoma by heat on brain. Hematoma by heat on brain. It is a heat hematoma. So this hematoma is extradural hematoma. This hematoma is extradural hematoma. This is known as heat hematoma. So, doctor, due to heat, I have told you heat rupture is a muscle rupture. Irregular margin with blood vessels and nerves are intact. Thermal fracture is a fracture of skull bone from inside. There is a fracture of skull bone from inside. It can cross suture line. Heat hematoma is hematoma of brain. It is always extradural in nature. Always extradural in nature. Now, sir, some important point. Due to burn, we have neck lacing. Neck lacing is homicide burn. Neck lacing is homicide burn. Generally, this is seen in South Africa. The people are killed by homicide burn. This is known as neck lacing. Neck lacing. In burn cases, we have shrunken organ. In burn cases, we have shrunken organ. These are known as puppet organ. These are known as puppet organ. Neck lacing is a homicidal burn. Puppet organ are shrunken organ. Street and avenue fracture. street and avenue fracture is long bone fracture in burn cases. It is long bone fracture in burn cases. This is known as street and avenue fracture. तो मेरे साथ रिवाइज कर लेना. Neck lacing is an example of which burn? Neck lacing is an example of which burn? Which burn? Okay. Homicide burn. Shrunken organ in burn cases are known as. Shrunken organ in burn cases are known as puppet organ. Long bone fracture in burn cases are known as which fracture? Long bone fracture in burn cases are known as street and avenue fracture. Street and avenue fracture. Very important. These are some important points of burn cases. Now, sir, what is scald? Scald is a type of burn. It is application of liquid more than 60 degrees centigrade. Application of liquid more than 60 degrees centigrade. This is known as scald. This is known as scald. There is no blackening because it is liquid. There is no blackening, no charring, no blackening, no charring, no singeing. Singeing is seen in hair burn. No blackening, no charring, no singeing. No singeing. What is seen? Skin is bleached. Skin is bleached. Bleaching of the skin is seen. Bleaching of the skin is seen. This is known as, yes, scald. So what is scald? Liquid or steam more than 60 degrees centigrade on the body. This produces scald. This will produce scald. There is no blackening, no charring. Charring is a blackening type. Singeing, no singeing. These are absent. This is absent, this is absent, this is absent. Only bleached skin are seen. So this is scald. Now I am coming to, sir, electric injury, electrocution. Electrocution. Sir, AC is more dangerous than DC. What is AC? Alternating current. Alternating current is more dangerous than direct current. It is more dangerous than direct current. Why? The reason is, sir, AC kar deti hai tesi. Alternating current is more dangerous than direct current. The reason is AC kar deti hai tesi. TC is tetanoid contraction. TC is tetanoid contraction. Alternating current is more dangerous than direct current because it causes, yes, tetanoid contraction. Sir, most resistant structure of your body for current electrocution is bone, then skin. Most resistant structure for electrocution of your body is bone, then skin. So, Dr. Saab, the highest resistant structure is bone. Tetanoid contraction is the cause of death. Highest resistant. Cause of death. Cause of death in electrocution is ventricular fibrillation. Cause of death in electrocution is ventricular fibrillation. Ventricular fibrillation, cause of death. Now, sir, what about postmortem finding? Sir, the entry burn in electrocution, this entry burn is a endogenous burn. This entry burn is a endogenous burn, and sir, this entry burn is known as Joule burn. This entry burn is known as Joule burn. This entry burn is a endogenous burn. This entry burn is known as Joule burn. So if you see, This is a jewel burn, just like a oval or round shape. The base is pale. The base is pale. This is known as jewel burn. So entry burn is known as jewel burn. So याद करने का तरीका J for झटका, J for jewel. J for झटका, J for jewel. In high voltage burn, we have crocodile burn. In high voltage burn, we have crocodile flash burn. Crocodile flash burn. In high voltage cases, we have crocodile flash burn. Crocodile flash burn. Jewel burn is entry burn or endogenous burn. In high voltage cases, we have crocodile burn marking. Crocodile burn. So sometimes you can get a question. Jewel burn is an electrocution burn. High voltage cases, we have crocodile burn. We have crocodile burn mark. Crocodile. Now, sir, metal, molten metal. The wire has metal. This molten metal goes inside the skin. This molten metal is known as current pearl. This metal goes inside the skin. This is known as current pearl. Current pearl. Okay. Now, sir, another important MCQ comes. Calcium deposition. Calcium deposition inside the bone. Calcium deposition inside the bone. This is known as bone pearl. This is known as bone pearl or wax dripping. These are two questions you can get in exam. Again, I'm revising, my dear friend. Molten metal which goes in skin. This is known as current pearl. Molten metal which goes in the skin, which is known as current pearl, and calcium deposition in bone. Calcium deposition in bone. This is known as bone pearl or wax dripping. This is known as bone pearl or wax dripping. Both are very, very important. Bone pearl. And Dr. Sam, कई बार question आया था, what is current pearl? It is molten metal. And what is bone pearl? Bone pearl and wax dripping are calcium deposition in bone. Calcium deposition in bone. So this is electrocution. Now I am coming to lightning injury. Lightning का मतलब होता है बिजली. हिंदी में बोलते हैं बिजली. अगर आपकी बॉडी पे बिजली गिर जाती है, that is known as lightning. So what are the possible injuries by lightning, sir? A very simple. Lightning fall on your body. Lightning fall on your body. Lightning fall on your body. These are the injury. Dr. Saab, these burn are known as filigree burn, arborescent burn, filigree burn, arborescent burn, Lichtenberg, flower petal burn. Lichtenberg, flower petal burn. What is the trick to remember? Lightning fall on your body, filigree burn, arborescent burn, Lichtenberg flower petal burn. Sir, why it is known as arborescent burn? See, it is a branching tree burn pattern. Branching tree burn pattern. This is arborescent burn. Sir, it is also known as keranographic burn. It is also known as keranographic burn. This is the branching tree pattern. Sir, air compression is seen behind the burn. Air compression is seen behind the burn. Air compression is seen before the current. not in front. And Dr. Saab, this effect is known as sledgehammer effect. This effect is known as sledgehammer effect. Now, Dr. Saab, why this filigree burn shape taken place? Because of denaturation of RBC. Why this filigree? Why this filigree burn shape take place? Because of denaturation of erythrocyte. Because of denaturation of erythrocyte. Denaturation of erythrocyte. So anyways, sir, this is a very, very important topic, like what is burn. Yes, sir, these are type of burn in lightning injury. Filigree burn, arborescent burn. डॉक्टर साहब कैसे याद रखना? बिजली गिरी, FL fall, filigree F, A arborescent, L Lichtenberg burn. These are also known as keranographic burn. These are also known as keranographic burn. Now, sir, I will ask you some question. Write down. Okay. What is the entry burn in electrocution? What is the entry burn in electrocution? Entry burn in electrocution. Anyone? Joule burn. What is high voltage burn known as? What is high voltage burn known as? Crocodile burn, because the skin look like crocodile burn. What is the highest resistance structure of for burn? Electrocution, sorry, electrocution, which is the highest structure resistance? Bone. Metal of the wire goes inside your skin. What it is known as? Metal of the wire goes inside your skin. What it is known as? Current pearl. It is known as current pearl. Calcium deposited inside the skin and subcutaneous tissue is known as wax dripping. Very good. Air compression in lightning injury is seen in front or behind the current. Front or behind the current? Behind the current. It is always behind the current. It is known as sledgehammer effect. It is known as sledgehammer effect. Sledgehammer effect. Now, I will show you two pictures which is related with this burn. Okay. I will show you. What are the name of burn? What are the name of burn? Lightning burn, FAL. F for filigree. F for filigree. Yes. F for filigree. A for arborescent. A for arborescent. Yes, sir. Sir, you can see this picture. This is crocodile flash burn and it is seen in high voltage cases. This is crocodile flash burn. This is seen in high voltage cases. High voltage cases. Crocodile flash burn. I will share these pictures today. Don't worry. Crocodile flash burn. So this is filigree burn. You can see branching tree pattern burn. I told you in lightning injury, we have branching tree pattern burn. This is known as lightning injury burn. This is known as lightning injury burn. This is known as filigree burn, arborescent burn, or yes, no doubt. Yes, friends, filigree burn, arborescent burn. These burns are bright lightning injury burn. Okay, anyways, sir. मैंने अभी तक आपको क्या क्या इंजरी पढ़ाई है मैं थोड़ा सा रिवाइज कर देता हूं. फर्स्ट आई डिस्कस हाइपोथर्मिया, विश्नुएस्की स्पॉट इज वेरी इंपॉर्टेंट. देन आई डिस्कस हाइपरथर्मिया, स्वेटिंग 3 मैकेनिज्म, स्वेटिंग मोर, स्वेटिंग स्टॉप, स्वेटिंग नॉट एक्टिवेटेड. तीनों बताई थी मैंने. आफ्टर दैट आई डिस्कस बर्न. वॉलेस रूल इज रूल ऑफ 9. आई डिस्कस रूल ऑफ पाम इज 1%. लुंड एंड ब्राउडर फॉर्मूला आई टोल्ड यू 40%, 60% इज लुंड ऑफ ब्राउडर फॉर्मूला. Heat rupture is a muscle rupture. Blood vessels are intact with irregular margin. Thermal fracture is a fracture of skull bone may cross the suture line. Then puppet organ are shrunken organ. Heat hematoma is brain hematoma, which is extradural in nature. Which is extradural in nature. Epidural or extradural both are same. This is heat hematoma of brain. Street and avenue fractures, these are seen in long bones. Neck lacing is a homicide burn, generally in South Africa it is seen. Then we discuss what is electrocution. Yes, it is electric current. What are current pearl? What are wax dripping? What are lightning burn? What is sledgehammer effect? In behind the current we have air compression. This is known as sledgehammer effect. Okay, एक एक लाइन के सवाल आते हैं सर, मैंने आपको बहुत अच्छे तरीके से पढ़ा दिया. Now, so we have discussed thermal injury, we have discussed electrocution, we have discussed lightning injury. Now I am coming to, sir, very, very important, mechanical injuries. Mechanical injury. In mechanical injury, the first is abrasion. Sir, abrasion is also known as gravel rash. Abrasion is also known as gravel rash. It is loss of epidermis. It is loss of epidermis. Loss of epidermis is known as this one, gravel rash. Now see, this is your epidermis. This is your dermis. If loss of epidermis is seen, this injury is known as abrasion. Loss of epidermis. This is known as abrasion. Loss of epidermis. Okay. Now, sir, what are the types of abrasion we have? Loss of epidermis, mainly it is known as gravel rash. First mechanical injuries, abrasion. Now, what are the type of abrasion we have? Number one. So number one is grazed abrasion. Grazed means by friction, sliding or by friction. If you have abrasion, this is known as grazed abrasion. By sliding or by friction, if you have abrasion, you are sliding on the surface. This is known as grazed abrasion. Sir, this is also known as brush burn. This look like a brush, that's why, and it gives burning sensation. That's why it is known as brush burn. It is most common abrasion of road traffic accident. It is most common abrasion of road traffic accident. Dr. Sir, when you are riding motorcycle or any vehicle and you slide on the surface, this will produce grazed abrasion. This will produce, no doubt, my dear friend, grazed abrasion, sliding abrasion. It is by friction. I will show you the picture because this picture is also important. If you see this abrasion, if you see grazed abrasion, this one, you can see this is by friction. You have a sliding abrasion. This is grazed abrasion. This is grazed abrasion, sliding. Okay. Now, sir, second abrasion is scratch abrasion. ग्रेस का मतलब घसीट से लगा. आप घसीट गए, that is a grazed abrasion, most common in road traffic accident.
What is brush burn?
ये इसी को ब्रश बर्न बोलते हैं.
Okay.
ये ब्रश की तरह दिखाई देता है ना, अभी आपको इमेज दिखाई थी. It look like a brush and it gives burning sensation. It is an example of brush burn. When you are dragging over the ground, there is a chances of burn, chances of abrasion. That is a brush burn. So it look like a burn. It look like a brush shape. You can see the shape look like a brush. That's why it is known as brush burn. Scratch abrasion. The first we discussed graze abrasion, घसीट से हुआ. Scratch is by nail or by pin. Nail and pin, someone scratches you. That is a scratch abrasion. By nail or pin, someone scratches you. आपने किसी महिला से लड़ाई की, उसने आपको नाखूनों से नोच लिया. That will produce scratch abrasion. तो लड़कियों से लड़ते हो, लड़कियां आपका माहौल बना दे, तो that is a scratch abrasion. Okay, this is scratch abrasion. Now the third abrasion is pattern. As the name suggests, my dear friend, it will form object pattern. It will form object pattern. That is a pattern abrasion. Now, sir, how object pattern is formed? It is of two types. It is of two types. How object pattern is formed in your skin. First is pressure abrasion. Second is imprint or impact. First is pressure abrasion. Second is imprint or impact. Now, sir, first pressure abrasion. What is pressure abrasion? Like a very simple example, ligature mark in hanging or strangulation, whatever it is. Sir, you are committing, this is your neck. You are committing suicide. Okay, this is a ligature mark on neck. This is because of pressure and it create object pattern. This is pressure abrasion. So first type of pattern abrasion is pressure abrasion. Second, bite mark. If you have bite mark on your skin, this is also an example of pressure abrasion. So pressure creating object pattern is a pressure abrasion. Pressure creating object pattern is a pressure abrasion. Now, sir, what is imprint or impact abrasion? If you have moving object, if you have moving object, see what is the difference. This is a vehicle. Everyone knows that vehicle is moving, and this vehicle on your skin produces tire mark. This vehicle on skin produces tire mark. It is also a pattern, but sir, it is a moving object. So moving object produces mark on the skin is a imprint. तो अगर ऑब्जेक्ट मूविंग है तो इम्प्रिंट है, दोनों ही पैटर्न है, बोथ आर पैटर्न बिकॉज बोथ आर फॉर्मिंग पैटर्न. ओनली डिफरेंस इज इन इम्प्रिंट ऑब्जेक्ट इज मूविंग एंड इन प्रेशर ऑब्जेक्ट इज नॉट मूविंग, इट इज क्रिएटिंग प्रेशर. इट इज क्रिएटिंग प्रेशर. डॉक्टर साहब, hanging ligature mark is an example of pressure abrasion. Tire mark on the body is an example of which abrasion, my dear friend? Anyone? Tire mark on the body is example of which abrasion? Anyone? Which abrasion? Yes, imprint or impact, both are seen. Tire mark on the body are example of imprint or impact abrasion. Yes, my dear friend. Yes, my dear friend. डॉक्टर साहब, घसीट से लगा वो है ग्रेज्ड एब्रेजन, नाखूनों से स्क्रैच हुआ वो है स्क्रैच एब्रेजन. पैटर्न एब्रेजन आर ऑफ टू टाइप, प्रेशर एंड इम्प्रिंट. प्रेशर इज ligature mark in hanging and imprint is if moving object producing abrasion. Moving object is producing abrasion. These are the example of abrasion. These are the example of abrasion. Okay, now sir, very very important word comes, how to decide the age of abrasion. Sir, first word comes scab. Dry blood or lymph. Dry blood or lymph, it forms scab. And Dr. Saab, scab of the abrasion forms in 12 to 24 hours. 12 to 24 hours, it is scab forms. This scab become red brown or brown in 2 to 4 days. This scab become red brown in 2 to 4 days. So scab form in 12 to 24 hours. This scab become red brown in 2 to 4 days. And also this is a very very important MCQ. Scab fall in 7 days. Scab fall in 7 days. Scab बनता कब है? Yes. और होता कब है? Decide कैसे करते हैं? Yes, it is scab forms in 12 to 24 hours first. Second, red brown scab is 2 to 4 days. And third, it fall in 7 days. It falls in 7 days. 7 days. Okay. Now this is the first injury that is known as abrasion. This is generally a destruction of epidermis. Now I'm coming to second injury, contusion, and Dr. Saab, contusion is also known as bruise. Contusion is also known as bruise. Sir, C for contusion, C for clotted blood, B for bruise by blunt trauma. What happens, sir? It is a injury of dermis. It is a injury of dermis. See, this is your skin, epidermis. This is dermis. And if you have blunt trauma, this is blunt trauma. Yes. This is blunt trauma. Blunt trauma. What will happen? Dermal blood vessels are ruptured. Ruptured blood vessel. What will happen? The blood will come out. Yes. This is a clotted blood. This will produce swelling. This is a clotted blood. This will produce swelling. Friends, this swelling is known as contusion or bruise. Clotted blood after blunt trauma produces swelling. This swelling is known as contusion or bruise. Contusion or bruise. Now, sir, generally the margin of the bruise are irregular. Margin of the bruise are irregular. So, Dr. Saab, first question comes, bruise is an injury of dermis. Bruise is an injury of dermis. It is by blunt trauma. It is by blunt trauma. Ruptured blood vessel produces swelling. Margins of the bruise are irregular. Margins of the bruise are irregular. Now, sir, in children, in old person, we have relaxed skin. Relaxed skin. So bruise are very easily visible. In children and in old person, we have relaxed skin. That's why bruise are very easily visible. Bruise are very easily visible in children and old person. Same thing in face, relaxed skin, bruise are very easily visible. In bony prominence, we have thin skin. So again, bruise are very easily visible. But sir, if you have thick skin, bruise are less visible, like palm and sole. Example of thick skin are palm, abdomen. Actually, sir, in thick skin, because of skin thickness, bruise are less visible. Again, I'm revising, my dear friend. Children and old person, bruise are easily visible. Face is the site where bruise are easily visible. Bony prominences have thin skin. That's why bruise are easily visible. But sir, the only is, yes, thick skin. Where skin is thick, the bruise are very less visible because of skin thickness. Because of skin thickness. Now, sir, a very important MCQ comes. Bruise has color changes. Bruise has color changes. If you see the color changes of the bruise, these color changes start from the periphery, like this is a bruise. These start from the periphery and goes to the center. These start from the periphery and goes to the center. Now, sir, what are the color changes and how do you remember? You just write down vibgyor. You just write down vibgyor. But what you need to do, sir, put R on the top. Put R on the top. These are the color changes. See, first is red color, violet plus indigo blue, brown, green, yellow, And O is not orange, my dear friend. O for original color. First color is red, then blue, violet plus indigo become blue, then brown. Doctor, red color is because of hemoglobin. Bruise has hemoglobin. Because of this, we have red color. Red color, it is hemoglobin. It is seen in fresh bruise. In 1 to 2 hours, we have hemoglobin. Then hemoglobin gets converted in deoxyhemoglobin. Then hemoglobin is converted in deoxyhemoglobin till third day. Till third day, it is blue color. Then deoxyhemoglobin converted in hemosiderin on fourth day. Then hemosiderin gets converted in hematoidine on 5th to 6th days. Hematoidine. Then hematoidine gets converted in bilirubin. 7 to 13 days causes yellow color. And Dr. Saab, no pigment on 14th day, so your skin become normal color. So your skin become normal color. Again, I am revising, my dear friend. Fresh color is a red color. Fresh color is a red color. Till 3 days, it is deoxyhemoglobin produces blue color. Fourth day, hemosiderin produces. Doctor, I am putting some question. See, first question. Hemosiderin color, brown color is because of which pigment? Brown color is because of which pigment in bruise? Brown color. Hemosiderin. Yes. Hemosiderin. Green color is because of which pigment? Green color. Green color. This question also comes in exam. It is because of hematoidine. Now, original color of bruise or normal color of the skin comes after how many days of the bruise? How many days of the bruise? Normal color. 14 days. Yes, Jabin, it is 14 days. What are the normal margins of the bruise? Irregular or regular? Irregular or regular? Normal margins of the bruise. Yes, these are irregular margins. These are irregular margins. So normal margins of the bruise are irregular. Normal margins of the bruise are irregular margins. Okay? Irregular margins. Okay. Irregular margins. Next one. So anyways, sir, these are bruise changes. Now I'm coming to Roxa. What you have to remember, Vibgyor, no issue for the Vibgyor, but R has to be put on the top. R को आपको ऊपर रखना. Then it is violet plus indigo blue, then brown, then green, then yellow. These are the color changes of the bruise. Okay, no issue. Now I'm coming to, sir, next one. Next one. What is ectopic bruise? Ectopic means trauma at different site, bruise is at different site. Trauma is different site, bruise is at different site. This is known as ectopic bruise. This is known as ectopic bruise. First example is raccoon sign. Raccoon sign is also known as black eye. Raccoon sign is also known as black eye. Sir, here we have fracture of anterior cranial fossa. Here we have fracture of anterior cranial fossa. Bruise is present, periocular bruise. fracture at anterior cranial fossa, bruise is periorbital or periocular, same. Second sign is battle sign. In battle sign, fracture is at middle cranial fossa. In battle sign, fracture is at middle cranial fossa and bruise is at mastoid tip. Bruise is at mastoid tip. Roxa, anterior cranial fossa fracture bruise is here and middle cranial fossa bruise is at mastoid tip. These are example of ectopic bruise. I will show you one picture of this one. This is an important picture. You can see this is raccoon sign. You can see periocular bleeding. Yes. This is black eye. This is an example of ectopic bruise. Black eye. Here fracture is an anterior cranial fossa, but bruise is periocular. In the same manner, if bruise is at mastoid tip, this will be the raccoon sign. This will be the raccoon sign. Dr. Saab, these are known as ectopic bruise. And friends, ectopic bruise are also known as migratory bruise. Ectopic bruise are also known as migratory bruise. Migratory bruise. So this is first bruise we discussed. Now we are coming to pattern bruise. We are coming to pattern bruise. Pattern bruise form pattern of object. Pattern bruise form pattern of object. Pattern of object. Like first very simple example, road. If you strike with road, you will see the bruise like this. If you strike with road on your body, you will see the bruise, road or stick. So this will be a line. This is known as tram line bruise. Tram line or railway line bruise. This is known as tram line or railway line bruise. There will be line by stick or road. तो अगर आप किसी लकड़ी से मारोगे तो सीधी सी लाइन बनेगी. That is known as tram line or railway line bruise. Railway line bruise. First pattern bruise, this one. Second, six penny bruise. Six penny bruise. Doctor Sahab, six penny is the name of coin. Coin shaped bruise. Six penny is the name of coin. That is a coin shaped bruise. It is seen in throttling, this one. If it compressed by finger, there is a six penny bruise. It is seen in throttling. This bruise is seen in throttling. Six penny. Number 3, butterfly bruise. Butterfly bruise. All are pattern bruise, my dear friend. All are pattern bruise. Butterfly bruise, child beating, that is battered baby. It is seen in battered baby syndrome. When you are frequently beating a child, there will be butterfly bruise. So I'm revising all the bruise again. Don't worry. First is tramline bruise, hitting with stick. This is tramline bruise. Coin shape bruise on neck. It is a six penny bruise. Butterfly bruise, beating a child, that is a battered baby. These are the example of. Yes, my dear friend, pattern bruise. They form pattern of an object. Now, artificial bruise, sir. Artificial bruise. Sir, by rubbing some plant product, by rubbing with some plant product, this will cause artificial bruise. What are the plant product which we rub look like a bruise? Sir, PSM. These are 3 plant which we rub on the skin. This produce artificial bruise. P for plumbago, S for semicarpus anacardium, and M for madar. Again, I am revising, my dear friend. These are three plant products: plumbago, semicarpus anacardium, and madar. This madar is also known as calotropis. Calotropis or akdo or akad. Akdo or akad. Semicarpus anacardium is also known as marking nut. Semicarpus anacardium is also known as marking nut. Another name is Bilava knoll. Bilava knoll. Anyway, sir, what is this? We use some plant product and rub on the skin surface. This look like a bruise. These are artificial bruise, but actually these are not by trauma. These are PSM. These are three plant products we rub on the skin that produces bruise-like thing, but it is a artificial bruise. Now, how do we differentiate, sir? How do we differentiate, sir? Very simple. It has regular margin. Traumatic bruise has irregular margin. It has regular margin present with irregular shape. Regular margin present with irregular shape. Shape is irregular because we are not considering it is an irregular shape. And itching present because of irritation. Itching present. Doctor, these are some important differentiating feature. Regular margin with irregular shape with itching present. Yes, sir. Yes, my dear friend. This is artificial bruise. What are the plant product? PSM. P for plumbago, S for semicarpus anacardium, M for madar or mother, जो भी आप बोलना चाहते हो वो बोलो. चलो एनीवेज थोड़ा सा पूछ लेते हैं आपको कुछ क्वेश्चन आंसर. Bruise is a injury of epidermis, dermis. Bruise is a injury of epidermis or dermis? Yes? Dermis. Dermis. Raccoon sign and battle sign are example of pattern bruise, ectopic bruise, artificial bruise.
Ectopic bruise.
Ectopic. Please यार माइक म्यूट रखना दोस्त यार, सब लोगों को डिस्टर्ब होता है. Ectopic और migratory bruise. Ectopic और migratory bruise. ओके. इन पार्ट में से सबसे अच्छा ब्रूज कहां दिखाई देता है? In which part of the skin the bruise is very well visible? Option A palm, option B sole, option C abdomen, option D face. Yes, the answer is face. Face is the right answer. Doctor Saab, when you dissect bruise, hematoma is present. Clotted blood is present, that is known as hematoma. When you dissect the bruise, hematoma is present because it's a clotted blood. And Dr. Saab, when you pour water on this hematoma is not washed away because it is impregnated in tissue. This hematoma is not washed away. This is known as incision test. This is to confirm bruise. This is known as incision test. This is known as incision test. When you dissect the bruise and pour the water, this hematoma is impregnated inside the tissue. This water hematoma is not washed away. This is known as incision test. Incision test. Okay. Anyway, sir, we have discussed two injury. One was abrasion. Second injury we discussed, it was bruise. चोट लगती है, थप्पड़ पड़ती है तो bruise, blunt injury से होता है bruise. Now I am coming to, sir, injury caused by sharp edge weapon. Injury caused by sharp edge weapon. Like I am giving example, knife. Now, sir, if knife is parallel to skin surface like this, knife is parallel to skin surface, knife is parallel to skin surface, this injury is known as incision. Incision. And if knife is perpendicular to skin surface like this, this is known as stab. What is the difference? Sir, if you see the incision, maximum dimension is length. If you see the incision, maximum dimension is length. Like see, this is maximum, this is length, this is length. But in stab, this is perpendicular, maximum dimension is depth. See, this is incision, this is stab. Maximum dimension is depth. That is the basic difference. Now, sir, incision is also known as cut injury, cut, and stab is also known as puncture. Puncture. Stab is also known as puncture, cut, cut. So, Dr. Saab, margins are regular in incisions. Margins are regular and clean cut. Margins are regular and clean cut in incision. At the end point of incision, this is the end point. At the end point of incision, we have telling. So telling is always seen at the end point of incision. Margins are clean cut and regular. Now I will show you the picture of incision. It is caused by sharp edge weapon. You can see this one. This is incision. See, this phenomena telling, this is at the end point of incision. At the end point of incision, this is the end point. At the end point of incision, we have telling phenomena. Tell is formed. Starting point, it is clean. But at the end point, there is a telling phenomena is seen. This is maximum dimension is length. Maximum dimension is length. This injury is incision. So margin, you can see the clean cut and regular margin. Margin, you can see clean cut and regular margin. Clean cut and regular margin. Yes, you can see this one. Okay, friends, this is injury, incision. Now, sir, at the end point, we have telling. So telling decides direction of weapon. Telling decides direction of weapon, because telling is always seen at the end point. At the end points. But sir, as I told you, margins are regular and clean cut, but there are two sides which are axilla and scrotum. There are two sides of incision, axilla and scrotum. When we have incised wound, sir, here margins are irregular because axilla and scrotum are very relaxed tissue. Here margin of the incision are irregular. Sir, these incised wound are known as lacerated looking incised wound. Lacerated, actually, sir, why these are known as lacerated looking incised wound? because margins are irregular in these side, axilla and scrotum. So how would you confirm, my dear friend? How would you confirm? You will examine with lens. In lens examination, you will find cut tissue and cut hair follicle. In lens examination, you would find cut tissue and cut hair follicle. Cut tissue and cut hair follicle. Because sharp edge weapon, there will be tissues will be cut and hair follicle. So, Dr. Sahab, this question is very common, my dear friend. Lacerated looking incised wound are seen on which side? The answer is axilla and scrotum. Lacerated looking incised wound are seen on which side? The answer is very simple, axilla and scrotum. Axilla and scrotum. Because why these are looking? Because here even we are using sharp edge weapon margin are irregular because of axilla and scrotum's rugosity, texture. This is known as. So how would you confirm, my dear friend? What you do, just examine with the lens, you will find cut tissue and cut hair follicle. Then you can say it is an incised wound, but looking like a lacerated. Looking like a lacerated. Now, sir, how to decide the age of incised wound? Yes, sir, a very important MCQ. In 36 hours of incised wound, capillary network is seen. Capillary network is seen. In 48 hours after incised wound, fibroblast is seen. Fibroblast. And Dr. Saab, this question comes in exam. 48 to 72 hours. 48 to 72 hours. Fibroblast is seen. In 3 to 5 days, collagen fiber is seen. So Dr. Saab, I have seen one question in AIMS exam. If you have collagen fibers in incised wound, what is the date or what is the age of that incised wound? The answer was 3 to 5 days. Capillary network. Capillary network in incised wound 36 hours. Fibroblast in incised wound 48 to 72 hours. And if collagen fibers present in incised wound, that suggests it is 3 to 5 days old incised wound. 3 to 5 days old incised wound. 3 to 5 days old incised wound. Now, sir, if incised wound present on genitalia, these are homicidal. Homicidal. अगर आपके नीचे इंसाइड वुंड है, इसका मतलब किसी ने काट के मारने की कोशिश की है. It is homicidal. But sir, multiple superficial incised wound on wrist. This is a wrist. If you have multiple superficial only, not deep, superficial incised wound, Dr. Saab, what does it suggest? Sir, these are suicidal in nature. These are known as hesitational cut, tentative cut, or trial cut. Again, I am revising, my dear friend. These are suicidal in nature. These are known as hesitational cut, tentative cut, or trial cut. Hesitational cut, tentative cut, or trial cut. Sir, multiple, like generally what happens? Superficial incised wound. It means you try to commit suicide, but these are suicidal, tentative, hesitational, or trial cut. So this is a very important injury, my dear friend. This is a very, very important injury, my dear friend. This is incised wound, tentative cut, trial cut, suicidal or hesitational cut. Hesitational cut. Anyway, sir, this is incised wound. This is incised wound. I can ask you some question. What is the maximum dimension of incised wound? Anyone? What is the maximum dimension of incised wound? Maximum dimension of incised wound? Length. Telling of incised wound seen at starting point or end point? End point. What are the area where incised look like lacerated wound? Lacerated looking incised wound. Scrotum and axilla. Scrotum and axilla. If fibroblast present in the incised wound, what does it indicate? Age of the incised wound. Age of the incised wound. 48 to 72 hours. Nice. Very good. Now I am coming to sir stab wound. As I told you, yes, collagen fibers present. What is the age of incised wound? Collagen fibers present in the incised wound. What is the age? Yes, absolutely right. Now I am coming to sir stab injury. As I told you, maximum dimension is depth. Maximum dimension is depth. Perpendicular to skin surface. Sir, if stab goes in cavity, it is known as penetrating wound. And if stab is through and through, if stab goes in cavity, it is penetrating. If stab is through and through means going from this direction and coming from another direction, this is known as perforating. This is known as perforating. Through and through is known as perforating. Perforating. Now, sir, shape of stab injury. Shape of stab injury is decided by line of Langers. Shape of stab injury is decided by line of Langers, which are present in skin. Which are present in skin. Line of Langers. If you have single sharp edge weapon, the shape is this. This is known as fishtailing. Fishtailing, single sharp edge weapon. The shape is like this, either this or triangle. These are common in single sharp edge weapon. If you have double sharp edge weapon, it is spindle shape like this. Single sharp edge weapon. This question comes in exam. Fishtailing is seen in stab injury when you have single sharp edge weapon. Only one edge is sharp. Only one edge is sharp. Two edges are sharp. It is spindle shape. This is spindle shape. This is spindle shape. Now, sir, hilt abrasion, hilt contusion are seen when knife is fully plunged inside abdomen or inside. When knife is fully plunged, there is a part of knife that is known as hilt. There is a part of knife that is known as hilt that is seen when knife is fully plunged inside. Again, I am revising, sir. Single edge has triangular shape. Double edge shape of the stab injury is spindle shape. Hilt abrasion and hilt contusion are seen when knife is fully plunged inside. When knife is fully plunged inside. So these are three important MCQ. And as I told you, the shape of stab injury is decided by line of Langers. The shape of stab injury is decided by line of Langers which are present in skin. Line of Langers. Now, sir, as as S. S for stab. One method of stabbing is suicide method. Suicide method. This is by using some sword. And Dr. Saab, this suicide method is in Japan. Stabbing, and there is a suicide method. Stabbing, and there is a suicide method in Japan by using sword. This suicide method is known as seppuku. And sir, this method is also known as harakiri. Harakiri. What they do? They take a sword and they hit the sword on abdomen. And sir, in abdomen, if they hit, there is evisceration. There is evisceration. Viscera come out, and that is leading cardiac collapse. This method of suicide, what they do? They take a small sword, hit on abdomen, viscera come out, that is leading a suicide by cardiac collapse. This method is known as harakiri or seppuku. So you can get a question. Harakiri and seppuku are suicidal method in Japan where sword is hit on the abdomen. This method is known as harakiri or seppuku. Harakiri or seppuku. Harakiri or seppuku. Like there is one picture, like sometime you can get a picture of this harakiri or seppuku. This is a suicide method in Japan, hitting on abdomen. Like you can get this picture. This is like shown. It is a hitting on abdomen. This method of suicide by using small sword. This is hitting on abdomen. This can lead harakiri or seppuku. This like I have seen 2 or 3 type of question in this harakiri or seppuku. Where it's been hit, it is abdomen. What is the type of injury? It is stab injury. It is a suicide or homicide? Sir, it is suicide. It's not a homicide. It is suicidal method in Japan. That is known as harakiri or seppuku. Harakiri or seppuku. Very, very important. Very, very important. Cause of death is cardiac collapse. Cause of death is cardiac collapse. Now, sir, I am coming to the last mechanical injury, that is laceration. Last mechanical injury, this is laceration. Laceration. Sir, first, what is laceration? It is by heavy blunt force. You have to use heavy blunt force. It leads splitting of epidermis as well as dermis. Splitting of epidermis and dermis by heavy blunt force. Heavy blunt force. See, this is your epidermis. This is your dermis. Now, sir, heavy blunt force, like it is a heavy stone like this. Heavy stone. So what will happen? What will happen? In these area, if you are using heavy stone, like epidermis will be split, yes. But dermis has a fibers. Dermis has a fibers. Because of fiber, when you see the margin, now tell me anyone, margin of the laceration will be regular or irregular, my dear friend? Generally, the margin of the laceration will be irregular because of fibers. Because of fibers, margin of the laceration, you will find it will be irregular. Now, what you need to do, sir? To confirm, because sir, sometime margin may be also regular, I will let you know. To confirm, green tea pila de. So now, green tea, to confirm, we can examine by lens. To confirm, we examine by lens. And Dr. Saab, in lens, what you will find? Crushed tissue and crushed hair follicle. So it means, sir, if the tissue is crushed, hair follicle are crushed, you can confirm, sir, this injury is laceration. Margins are irregular, but I will let you know like one injury of type of laceration where margin may be different. Margin may be different. Now, sir, write down types of laceration. So this is a very important MCQ. Confirmation of laceration is by crushed tissue and crushed hair follicle. Confirmation of laceration is by crushed tissue and crushed hair follicle. Crushed tissue and crushed hair follicle. Okay. Now, sir, see what are the types of laceration? Types of laceration. Types of laceration. Number one, stretching, stretch laceration. Number one is stretch laceration. Sir, it's a very simple one. When you have tangential force, example, this is tangential force leading overstretching of the skin. So this is running over by motor vehicle. Running over by motor vehicle. Sir, if you see, the skin is stretched like this is running over by motor vehicle. If skin is overstretched, that is a stretch laceration. Running over by motor vehicle. Running over by motor vehicle. This is tangential force causing stretch laceration, stretching of the skin, overstretching of the skin. Second, sir, second is very important, shearing laceration. Shearing laceration. Sir, shearing laceration is also known as avulsion. Shearing laceration is also known as avulsion. Sir, see, what is the meaning of shearing laceration? See, this is your hand. This is tissue. And if this tissue is separated, this injury is known as avulsion. If this tissue is separated, detached, this is known as avulsion. Detachment, I would use a word detachment. Now, sir, one type of avulsion, I will tell you two types. One type of avulsion where tissue is separated with attached margin. This is known as flaying. And another type of avulsion where skin just come out like a glove. This is known as degloving. Just like a glove is coming out, it is degloving. I will like see, I will tell you the picture. Then you will realize what is this. Okay. This one. This is very important. You can see. So see, this is avulsion. This is a avulsion. But what type of avulsion is this? Here, skin is separated with attached margin. This is flaying. It is avulsion. It is a type of avulsion. Type of avulsion. Another type of avulsion. See, this is skin is just coming out like a glove is coming out from the hand. This is also a type of avulsion. So anyways, what I want to tell you, sir, degloving and flaying are example of avulsion, which are shearing laceration. Shearing laceration. Very, very important. So first we have seen stretch laceration, tangential force. Second, we have seen shearing laceration. Third is tear. Tear is a simple tear. Tear is a simple tear. Splitting of surface. Now, sir, fourth is cut laceration. Dr. Sahib, cut laceration is also known as chop wound. Cut laceration is also known as chop wound. It is produced by a heavy weapon like axe. Cut laceration is also produced by heavy weapon like axe, kuladi. Dr. Saab, see why it is known as cut laceration. It cut the tissue as well as crushed the tissue. It will cut the tissue as well as, like laceration, crush the tissue. Like laceration, crush the tissue. See, it look like this. Heavy weapon like spindle shape. There will be very high gapping. Gapping will be more. This will be more gapping. This is not a normal gapping. More gapping between two margin. And Dr. Saab, actually it is by a axe, which is a heavy weapon, you will find cut tissue as well as crushed tissue. You will find cut tissue as well as crushed tissue. Dr. Saab, it is, I would say, it is a link between incised wound and lacerated wound. It will have two findings, cutting of the tissue and crushing of the tissue. This is known as chop wound. This is known as chop wound. Chop wound. Now I'm coming to laceration number 5, my dear friend. Split laceration. Laceration number 5, that is known as split laceration. Therefore, again I'm revising, my dear friend. Stretch laceration is by tangential force, stretching of the skin. This will produce stretch laceration. Shearing is avulsion separation. If separation with margin, it is flaying. Glove like this is degloving. Tearing is just a split. Chop wound is cut laceration, cutting and crushing by axe. Now I am coming to the last laceration, split laceration. Sir, first of all, split laceration is used when laceration is on bony prominences. When laceration is on bony prominences like scalp, forehead, scalp, forehead, scalp, forehead, eyebrow, scalp, forehead, eyebrow, this one, chin, this area, chin, iliac crest, and perineum. Sir, actually, I want to explain in a very simple way. I will show you the picture of this also. Sir, see, just touch your scalp and forehead. It is a tight skin. It is a very, very tight skin, my dear friend. Very much tight skin. It is a very much tight skin. So skin is minimum. So what will happen, sir? Here, because it is a tight skin, fibers are minimum. You will find regular margin. If you have heavy blunt force, you will find regular margin. And Dr. Saab, I have already told you, regular clean cut margin are seen in incised wound. So these are known as incised looking lacerated wound. These are known as incised looking lacerated wound because of regular margin, because skin is minimum, because these are seen on bony prominence. So heavy blunt force on bony prominences, this is split laceration. It look like incised wound. That's why. But as I told you, how would you confirm? By lens. Because it is by blunt force, you will find crushed tissue and crushed hair follicle. Crushed tissue and crushed hair follicle. You will find crushed tissue and crushed hair follicle. Look, sir, I'm going to show you the picture because this picture can come in exam. And this is a very important picture. First, I will explain this again. Don't worry. This is a very important picture. This is incised looking laceration, not lacerated looking. See the difference, sir. What is the meaning of incised looking? See, It look like incise, but it is a lacerated. It is incise. It look like incise, but these are seen on bony prominence. Like what are the bony prominences? Perineum. And one more side you can write down shin. Shin is anterior part of leg. Shin is anterior part of tibia. Tibias or leg anterior part. This is not shin. Okay. Now first I will show you the picture, then we'll see what is happens. See this one. Okay. Okay, scalp, SCALP, scalp laceration. Scalp laceration. Okay, that is sufficient. Don't worry, I will show you. Don't worry. Scalp laceration. Okay. See, this is a very good picture. I will show you. So just get a screenshot of this. Yes, sir, you can see. If you see, this is a picture which is a laceration on scalp. But if you see, the margin are regular and clean cut, my dear friend. Why? Because skin is minimum. Skin is minimum. Fibers are minimum. Irregular or other margins are not seen. Margins are clean cut. Dr. Sahab, this laceration, Dr. Sahab, this laceration is known as incise looking laceration. So how would you confirm? It look like incise, but it's a laceration. You will confirm by crushed tissue and crushed hair follicle. Dr. Sahab, I will ask you a few questions. Okay. I will ask you first few questions, then you will realize like your concept is clear or not. See. First question. इरशाद स्क्रीन थोड़ा नीचे करना. कौन सा स्क्रीन, कौन सा पार्ट दिखाना है तुम्हें? Which part? Avulsion is separation. Okay. Which question was in MCI last exam? Which question was there? Which question was there in MCI? कौन सा? Which question? Chop wound. Okay. If you want to see the picture of chop wound, I will show you the picture of chop wound also, because it is a heavy gaping wound. I will show you the picture of chop wound also. This is inside looking laceration, chop wound. Chop wound on the neck. You can see these are the example of chop wound. Better chop wound is by X, which is a very good picture of chop wound. Chop wound on neck. Yes, you can see this picture is also of chop wound. You can see this is by X. You can see this is a gaping wound. These are multiple gaping wound. This is known as chop wound, and there will be feature of cut injury as well as crush injury. Chop wound. Okay, anyways. So heavy gaping would be the chop wound. Heavy gaping will be the chop wound. Now, sir, write down. Actually, Vicky, telling is seen in laceration, incision, as well as stab. What is telling? At the end point, whatever weapon we use. स्लाइड शेयर नहीं हुई थी. विच स्लाइड? कौन सी स्लाइड शेयर नहीं हुई?
जो आप लेक्चर आए थे वो शो नहीं हुई.
कौन सी नहीं हुई? वो हो गई स्कैल्प वाली हो गई.
हाँ वो हो गई सर, चॉप बाउंड नहीं हुआ.
अच्छा, चॉप बाउंड नहीं हुआ. ओके ओके, वेट, चॉप बाउंड दिखा देता हूं मैं आपको. कहाँ गई चॉप बाउंड? नाउ अब दिखाई दे रही है? कैन यू सी?
यस सर.
This is by X. This is a multiple gapping wound. This is known as chop wound. The gap will be there because it's a high blunt force. It's a heavy blunt force. Multiple gapping wound. Now I am putting some question in front of you. Okay, get ready. First question. A type of avulsion where skin is attached with some margin is known as. Type of avulsion where, yes, it is flaying. Yes, it is flaying. Very good. Flaying. Line of dash decide the shape of stab injury. What is this line? Dash decide the shape of stab injury. Line of langers. Line of langer decide the shape of stab injury. Very good. Now listen carefully. Lacerated looking incised wound present on which part? Lacerated looking incised wound present on which part? Means these are incised wound looking like laceration. दामोदरन हो गया ना, कल्याण तेरा गलत कर दिया ना. Lacerated looking incised wound are present in axilla and scrotum. अब second question. Inside looking lacerated wound are present in bony prominences. Yes, you are absolutely right. How would you confirm lacerated wound? By cut hair follicle or by crushed hair follicle? Lacerated wound is confirmed by cut hair follicle or crushed hair follicle? Yes, answer is crushed hair follicle. Very good. In chop wound, you will find cut hair tissue, cut hair follicle, crushed hair follicle, both. What will be the answer in chop wound? Cut hair follicle, crushed hair follicle, or both? In chop wound, both. It is caused by, yes, it is caused by X. You will find both. Absolutely right. Running over the motor vehicle, creating tangential pressure produces which type of laceration? Tangential force produces, yes, it is stretch laceration. Spindle shape of stab wound is seen when you have one sharp edge margin of the knife, double sharp edge of the margin. Yes, it would be double edge. Fish tailing is a phenomena seen in stab injury or incised wound. Stab injury or incised wound? Stab. Doctor, tailing is seen in every wound. Tailing can be seen in lacerated. Tailing can be seen in stab. Tailing can be seen in incised. Best in incised, but fish tailing is only seen in stab. Fish tailing is only seen in incised wound. Anyway, sir, these are some very important points we are coming to, my dear friend. These are some very, very important points. Now, sir, write down self-inflicted injury. Self-inflicted injury. If you inflict injury on your own body, if you inflict injury on your own body, it is known as self-inflicted injury. Self-inflicted injury. Fabricated wound. Fabricated wound. Fabricated wound may be produced by himself or by other, but sir, with your consent. It means, sir, you are having wound maybe because you are producing himself or by other with your consent. This is known as fabricated wound. खुद के खुद लगाना, that is self-inflicted, but maybe by yourself and maybe by other with your consent, it is a fabricated wound. Defense wound, sir. Friends, you are defending, means someone is hitting and you are defending. Most common side is you are defending, someone is hitting. Most common side is extensor aspect of forearm. This is extensor aspect of forearm. This is the most common side. Knuckles. Knuckles, this area. This is knuckle, this area. Metacarpophalangeal joint. Knuckles, this area. Or inner aspect of forearm. These are the common site where you have defense wound. This is the extensor. Someone is hitting and you are defending. कहते हैं ना मत मारो यहाँ पे लगते हैं. So there are, first is this, yes, extensor aspect of the forearm. Knuckles, inner aspect of the forearm, or on palmar surface. This area, palmar surface. These are defense wound. These are known as defense wound. Most common site is extensor aspect of the forearm. Knuckles, knuckle is metacarpophalangeal joints, inner aspect of the forearm, and palmar surface. These are the example of defense wound. These are the examples of defense wound. Anyway, sir, this is all about mechanical injury we have discussed. देखो खुद की खुद मारना self inflicted. Fabricated का मतलब आपने fabricate किया है, मन गणत बनाया, maybe by you, maybe by other with your consent. That is a fabricated. And last is defense. You are defending yourself and you are getting injury. That is known as defense wound. Now, sir, a very, very important topic comes, regional injury. Regional injury. In regional injury, first we'll see skull fracture. First we'll see skull fracture. Sir, most common bone which is fractured, it is temporal bone. Most common bone which is fractured, it is temporal bone. Temporal bone. Most common fracture in skull bone, this is a linear fracture, which is also known as fissured fracture. Most common fracture of the skull bone is a linear fracture or fissured fracture. Both are same. Linear or fissured fracture. Bullet produces gutter. It is known as gutter fracture. But sir, this bullet is a tangential bullet, not perpendicular. This tangential bullet produces gutter. This is a gutter fracture. gutter fracture. Sir, comminuted fracture. Comminuted fracture is known as spider web fracture. It is just looking like a spider web. This is known as spider web fracture. Fracture surrounding foramen magnum. Fracture surrounding foramen magnum is a ring fracture. Most common bone is a temporal bone. Most common type of fracture is a linear or fissure fracture. Bullet produces gutter fracture. Comminuted fracture is a spider web fracture. Fracture surrounding the foramen magnum is a ring fracture. Because of fracture, if sutures are separated, it is known as diastatic fracture. Diastatic fracture. Hammer produces depressed fracture or signature fracture. If you see, I will show you the picture. Hammer produces sutural separation is a diastatic fracture. Hammer produces depressed or signature fracture. In infant skull bone, we have pond fracture, and pond fracture is also known as ping pong fracture. Pond fracture is also known as ping pong fracture in infant. It is known as pond fracture or ping pong fracture. And Dr. Saab, if you are riding motorcycle, there is motorcyclist fracture. First of all, sir, motorcyclist fracture is fracture of base of skull, and base of skull is divided in anterior half and posterior half. Motorcyclist fracture is a fracture of base of skull. Base of skull is divided in anterior half and posterior half. We have hinge fracture line. We have hinge fracture line. Again, I'm revising. Most common bone is a temporal bone. Most common fracture is a linear fracture. Tangential bullet produces gutter fracture. Gutter fracture bullet से होता है, उसको बोलते हैं gutter. Ring fracture surrounding foramen magnum. Spider web is a comminuted fracture. Sutural separation is a diastatic fracture. Hammer produces depressed fracture or signature fracture. Infant skull bone is a pond fracture or ping pong fracture. Motorcyclist has base of skull fracture. So base of skull fracture, yes, friends. It is known as divided in two half, anterior half and posterior half. So I will show you some images. This is shape of stab wound, I told you. This is a spindle shape, wedge shape, slit shape, and this is fish tailing. These are the shape of stab. Just go and see these shapes. I have already told you this one. These are the type of injury: abrasion, laceration, avulsion, yes, amputation, puncture, incision. Harakiri, I told you. Now, sir, see the fracture. If suture is separated, this is known as diastatic fracture. Done. Diastatic fracture. This is pond fracture, fracture of infant skull bone. It is also known as ping pong fracture. It is also known as ping pong fracture. Ping pong fracture. This is by hammer, depressed fracture, and sir, depressed fracture is also known as signature fracture. So this is comminuted fracture. This is also known as spider web fracture. This is a comminuted fracture. You will see it look like a spider web. This is known as spider web fracture. Spider web fracture. Now, sir, just get a rapid division. You will see. You can see. Now, first question, bullet produces which fracture, my dear friend? Bullet injury. Bullet injury produces which fracture? Write down. Yes, gutter fracture. Which bullet? Perpendicular or tangential? Tell me. Perpendicular or tangential? Anyone? What is the answer? Yes, friends, it is tangential bullet. Spider web fracture is produced by. Spider web fracture is produced by comminuted fracture. Spider web fracture is produced by comminuted fracture. Absolutely right, friends. Which is the most common bone of skull fracture? Most common bone of skull fracture. Temporal bone. Most common skull bone to be fractured is temporal bone. Temporal bone. Which is the most common skull fracture? Anyone? Which is most common skull fracture? Answer. Most common skull fracture. What is the answer? Yes, friends, most common skull fracture is a linear fracture. Hammer produces which fracture? What is the name of fracture produced by hammer? Anyone? What is the fracture produced by hammer? Yes, friends. It is. Yes, friends. It is. Okay. Depressed fracture or signature fracture? Depressed fracture or signature fracture? Okay. Ping pong fracture is seen in. Ping pong fracture is seen in. Ping pong fracture is seen in. Yes. Yes, friends. Absolutely right. Infant, pediatric age group. Very good. P for ping pong, P for pediatric. Okay. And motorcyclist fracture is a fracture of which part of the skull? Which part of the skull? Which part? Yes, base. Base is divided in. Base is divided in. Yes, anyone? Okay. Base is divided in anterior half and posterior half. Base is divided in anterior half and posterior half. It is known as motorcyclist fracture. It is known as motorcyclist fracture. Motorcyclist fracture. Anterior half and posterior half. Okay, very good. Very good, very good, very good. Now, अल्कोहल पी के, शराब पी के अगर आपने किसी के साथ बदतमीजी की है, which IPC will be applicable? After drinking alcohol, you misconducted with anyone, which IPC will be applicable? Anyone? Okay. Yes, it will be 510 IPC. It will be 510 IPC. Very good. And or the image session. I'm sending you both lectures as well as the images. Okay, आपको पीपीटी दूसरा चला गया. Wait. Inside looking lacerated wound are seen in. Inside looking lacerated wound are seen in which area? Tell me. Which area? Yes. कौन से एरिया में होते हैं? Axilla and scrotum. Lacerated looking inside wound are seen in. अरे करम जले, lacerated looking inside wound are seen in. उल्टा बोल रहे हो, जूते खाओगे. Yes. Inside looking lacerated wound are seen in scalp and bony prominences, and lacerated looking inside wound. Lacerated looking inside wound are seen in. Lacerated looking inside wound are seen in on those area which I told you. Okay. Okay. So this is the difference we can see. Inside looking and lacerated looking inside wound. Inside looking lacerated and lacerated looking inside wound. Okay. दोनों का ध्यान रखना, गड़बड़ी मत करना. यहाँ आदमी गड़बड़ी करता. Now I will show you some pictures. Actually, one or two picture I will show you. The first is if there is any picture in Google of linear skull fracture. Most common fracture is linear skull fracture. If any picture is there, you can see that picture. If it's good picture, I will show you. I think it's not given anywhere. Linear skull fracture. Linear skull fracture. Most common fracture is linear skull fracture. Not a good picture given here, but it's just a line. As straight line is a linear skull fracture. That is sufficient. In second picture, I can search gutter fracture. Actually, I have not gutter fracture. Skull. Okay, this is good. I will show you. This is forming a gutter, and just get this click. Okay. नहीं दिख रहा, मेरे को भी मालूम नहीं दिख रहा, अभी दिखाऊंगा. This is gutter fracture. You just get this click. So you can see this is a gutter created by bullet. This is a gutter created by bullet in skull bone. This is a gutter. This is a gutter fracture. Gutter created by bullet. Gutter created by bullet. Okay, is it visible, my dear friend? Okay, second, this one. Sir, see, the very good picture here. This is a linear picture, linear fracture. This is a linear fracture. This is a linear fracture. This is a linear fracture. Okay. These are sufficient images for you, I think. So, अभी screen दिखाई दे गया ना आपको? Have you seen the screen? Linear fracture and gutter fracture? Yes, sir. दिख गया ना? तो साहब, this is all about for today's class. हाँ, मैं थोड़ा ज्यादा आपको डिटेल में पढ़ा रहा हूँ. Like not like previous classes. तो उससे थोड़ा 10 to 20% ज्यादा है. I think it would be very helpful for you. Okay. Okay. Bye bye. Take care, everyone. Good night.